Overall, like all exercise is positive. It's super, super important. You can't have perfect health without also exercising. But in the moment, your glucose may spike during exercise, and that could be completely normal. So it's really about how much energy you're demanding from your exercise. If you're in a fasted state and you're doing HIIT training or you're doing heavy weightlifting, you're probably going to see a glucose spike just because the energy available circulating is not enough to power that quick, intense workout. So your body will stimulate some glucose for you to use. But it's different than a food spike because you're using it right away. Just making sure you're moving throughout the day can also really improve glucose values.
It really occurred to me that CGMs are not just for diabetics. And obviously, I'm from a traditional Western medicine training, but also have functional training. And the more that people understand how our food influences our blood sugar, the more they will understand it's not just people walking around saying carbs are bad or you can never have dessert or a glass of wine. But when you can see that information in real time, it can reinforce or discourage people from continuing to make the same choices. So I know that you started in clinical nutrition. So what was it about? And I know we probably are very aligned on this. What was it about the traditional kind of Western medicine mindset about food and nutrition that really started to cause you to second guess what you were doing, the environment that you worked in?
Yeah, and there's certainly multiple components to it. We could have a whole podcast on this topic, but I'll try to keep it brief. Part of the frustration was, in a hospital setting, in a clinical setting, it's, get them out as fast as possible, put a Band-Aid on it, add a medication, whatever treatment we need to do so we can get you out, which is good. We don't want people in the hospital longer than they need to be. But then there's a disconnect with communication and follow-up to provide the appropriate care that person needs to not come back to the hospital. So what I'm sure you saw is you see these frequent flyers. People are just in and out of the hospital all the time because we're never, ever addressing the root cause, which is often lifestyle. And that's just really not touched on. And so it's frustrating because you see all this suffering, this unnecessary amount of procedures and medications and pain that people are going through when really we could have prevented all of that, or at least minimized it by talking about lifestyle. And I think the other frustrating component is when you finally do get to have that lifestyle conversation, some of the traditional recommendations are not actually that helpful. So I'm a registered dietitian. I also was trained traditionally. And some of the recommendations, which maybe are meant well, maybe are not, who knows what's going on behind closed doors, but they didn't necessarily help people. So standard recommendations to eat, 45 to 65% of calories from carbohydrates, have small frequent meals. These recommendations were not moving the needle. Once you have chronic conditions, multiple chronic conditions, you have to make even more extreme measures to address it and to fix it. And these just weren't cutting it. So I was frustrated with the lack of conversations around nutrition and addressing the root cause. And then I was also frustrated with the nutrition recommendations I was taught that I could see were not working when I did have someone who was finally motivated and excited to address the root causes of their problem. Then it was well, they lost their excitement because they're not seeing any progress or improvement. So from that, I was well, we have to start somewhere else. And so really dug into the research about what is driving all of these problems. And it all points to metabolic health and insulin resistance. They're all connected. That's why most people don't just have one chronic condition. Eventually they get multiple because it's all connected. And really at the heart of that is glucose. There's other measures, other metrics involved. But I like to think of glucose as sort of the 80-20 best bang for your buck when it comes to metabolic health, because it's easy to measure and it tells us a lot. So it's not just telling us how many carbohydrates you're eating, which of course increases or decreases glucose levels, but it's also impacted by sleep and stress and exercise and fasting when you're eating the circadian rhythm, all of these factors that are so important for holistic health. Glucose plays a role in that. So when we look at people's glucose levels, we get such a good view of what's going on and maybe where the problem areas really are that we need to dive into. And I think you made a really good point that it is personalized too.
Mhm.
Some people thrive on a higher carbohydrate diet, and that's great. And a lot of people don't. And so we have to know what's your unique situation, your combination of genetics and epigenetics and the life you've lived that far, where are you at right now and what's best for your body. We don't know that unless we're measuring some sort of data to tell us where to go. There is not one size fits all, approach or diet. And I'm sure that you agree with that as well. And that's why I think data is also really helpful, because it can make something very personalized, which is also more motivating for the customer, the patient, because they know this is how my body responds, and I'm much more driven to stick with that plan or stick with that goal I set because I know how meaningful it is. It's not just like a generic thing somebody told me that I'm like, maybe it's working, maybe it's not, because you can see the data.
And I think that's such an important point, that objectivity, because it's one thing if we as clinicians are making recommendations and then someone has to go home and implement changes that we've suggested. But if they on their own are able to look at the information and say, oh, okay, I clearly overdid it with the, insert whatever it is, Thanksgiving, holidays. I mean, we're probably not doing as much celebrating in 2020, or if we're doing it in the privacy of our own homes. But having that ability to reflect on the choices that we've made and say, okay, I need to ratchet things in because my CGM data, again, continuous glucose monitoring, is not where it should be. So let's define normal so that people understand, like, what objectively are we looking for? What do we ideally want to see for a fasting glucose? So when I think about fasting, I think usually a lot longer than 8 hours, but I used to tell my patients 8 hours is a good, reasonable, but probably closer to 12. So if we're looking at a fasting glucose level, what would you ideally like to see?
Yeah. So in a fasted state, technically defined as at least 8 hours without food. We want to see that between 70 and 90, with a caveat that some non-diabetics who are perfectly healthy, especially somebody on a ketogenic diet or a very low carb diet, they might actually have a fasting glucose less than 70. And if you have no symptoms, so no like dizziness, lightheadedness, that's perfectly fine. But traditional recommendations would say anything below 100 is okay. But there's quite a bit of evidence to suggest that buffer zone of 90 to 100 is an independent risk factor. So that's kind of a yellow flag in my mind of not prediabetes technically, but things are maybe starting to go awry. And fasted glucose values could be temporarily increased. So that's why CGM is helpful, because we're not just looking at this one snapshot in time, like annually at your fasted glucose level. We get to see every day, every morning, what does it look like? Because sometimes if you get a bad night of sleep, that number is going to be way high. Or if you're super stressed because, something's going on, or if you're sick, if you have COVID, or if you have flu or something. So we're looking at, given the circumstance, that if you're not sleeping every day and you're stressed every day and it's perpetually elevated, that's obviously more of a chronic problem we need to address. But technically, like 70 to 90 is the sweet spot I'm looking for in a fasted glucose.
And it's interesting, I'm laughing because one of my doodles is starting to bark. So hopefully he's going to be quiet. And I know that some of the study research I've looked at has indicated that if you get less than 6 hours a night of sleep, and I know there are plenty of you listening that probably do that and think it's no big deal, you reduce your ability to control your blood sugar by anywhere from 50 to 60%. And I actually had Dr. Kirk Parsley on a few weeks ago, and he was saying that on average, if you get less than 8 hours a night of sleep over the course of a year, that can actually influence your weight gain by, I think he said 14.3 pounds, which for anyone that's listening, I don't want to be 14.3 pounds heavier this time next year. So sleep is really, really important. And I think it's so helpful for you to, getting back to glucose, kind of defining what is normal so that people understand, like, knowledge is power. And this is really going to date me, but when I went through my nurse practitioner program and finished in 2000, which is a long time ago, we were looking at numbers under 140. So it tells you, like, we're getting better about identifying people that are at risk and what the normals are, but we've still got room to go. So when we're looking at other types of labs, and I know we kind of touched on this before we started recording, I had mentioned like fasting insulin as being one of those first kind of indicators. But what I found most interesting, Kara, was when I was listening to you on another podcast, when you were talking about hemoglobin A1C. Can you share with our listeners? Because I think most of us are thinking, as long as my hemoglobin A1C and fasting insulin look good, I'm good. But you're suggesting, and this sounds completely reasonable, that isn't really the case. So what do people need to be concerned about?
Yeah, absolutely. And, hemoglobin A1C, I think, has in a mainstream audience gotten perception as being the gold standard for if I have diabetes or not. And it is
Mhm.
used to diagnose diabetes, but it has a lot of flaws. And I
Mhm.
think, just like you said, 20 years ago, we were looking at fasted glucose of 140, and now we've adjusted that to 100. I guarantee you in 5, 10 years, that threshold is
Mhm.
going to be at 90.
Mhm.
I think eventually people will move away from A1C as well because of
Mhm.
the evidence that's coming out about it. One thing that's important to know is what is it actually measuring?
Mhm.
People think like this means diabetes or not, but really, what it's doing is it's measuring how much sugar is on your hemoglobin molecule.
Mhm.
So it's like, when we have blood sugar circulating in our system, it glycates proteins, it makes
Mhm.
it sticky. And so hemoglobin molecule is on your red blood cell, and an average red blood cell lives for 90 days. So what a hemoglobin A1C is telling us is how your average glucose values have looked over the last 90 days, 3 months. So inherently, what it's measuring is, slightly not that useful because it's telling us an average. An average is interesting, but it's missing any sort of variability. So um, you could be spiking to 200, which is really high, and crashing to 60 and having reactive hypoglycemia and all types of trouble with your blood sugar levels. But the average could be right at a nice sweet spot, and you wouldn't catch that at all in an A1C value. So that's really the first flaw in my view. And the research says that those spikes and that swings in your glucose values, the glycemic variability, is actually the most important measures to be looking at to predict diabetes and insulin resistance and cardiovascular disease. So we want to look at those metrics. The other reason it's unreliable is because it's making the assumption that your red blood cell lives for 90 days, which for a lot of people is not actually true. So anemia, which is extremely common, alters the lifespan of your red blood cells. Even high glucose values, if you have diabetes, alters the lifespan of your red blood cells. Blood loss, smoking, B12 deficiency, low carb ketogenic diets, all of these can skew the lifespan of your red blood cells, which can either make it a false positive or a false negative. And they have researched this, and it's only about a 50% sensitivity to perfectly match with actual average glucose values. So that's not great, And in
Mhm.
general, I say hemoglobin A1C is good for a proxy measure. Normal is below 5.7%. So if you come back with a 10% value, that's high. Like no amount of skewed red blood cell life is compensating for that. So that tells us something. Another is for personal tracking. If you get it every year and it goes from 7 to 6 to 5, and you haven't changed anything with, anemia or any of these other, contraindications, then you can at least track your progress. It's going in a right direction. And that's where I see the use case of a hemoglobin A1C is for those two applications, like extreme outliers and then just personal trends tracking. But I have a lot of people who come to me and they're like, my A1C is 5.9%, and I'm freaking out, and their CGM data is amazing. And I'm like, well, that tells us so much more. So I just think there's this misconception that hemoglobin A1C is a gold standard. So that's really the message I'm trying to get out, is that it has its flaws.
Well, I think that's really valuable because I know that, there are many of us that evolve, shift, and change as clinicians. And then there are some people that aren't as good about that. And I know the one thing that I've been consistently telling my female patients is let's focus on that fasting insulin because we know sometimes that is oftentimes the first thing that will start to shift as you are becoming insulin resistant. And interestingly enough, last time I had mine drawn, my nurse midwife said, I think this might be the lowest insulin level I've ever seen. And so I was like, well, what does that mean? And so she said, well, I don't think I've ever seen it be a 2.1. And then I go on to find out that it's not that unusual. It's not as if I'm dead, but it just means that there's more metabolic flexibility. And that's really what we're looking for. And a fasting insulin is not a weird or unusual test. It is a fairly common test, but you just have to have your healthcare provider order it. And where do you like to see your ranges for that? I get differing opinions. So I'm curious to know what your kind of standard is.
Yeah. So for our customers that are really focused on like prevention, optimal metabolic health, and they don't have diabetes, I really like to see it at 2 to 5, which is kind of probably the tighter, more strict range.
Yeah.
If we're working on progress, anything closer to that range is a win. Traditional reference range, I think, is something crazy like 5 to 20 or something like that. So that's another caveat for those who don't know. I'm sure you've said this before, that reference ranges are not always what you want to look at as well. That's just a standard deviation of whatever that lab uses in their population. And the average person is not that healthy, so we don't necessarily want to be in the average. Sometimes we want to be in a different optimal range. But 2 to 5 is what I look for. And we highly encourage, we're not a clinic, so we're not ordering labs, but we highly encourage people to get a fasting insulin because it can tell us a lot, and it's very complementary to CGM data. And something that I think is useful with CGM data as well is it's really hard to get a postprandial insulin value done. So fasting insulin is awesome, just like fasting glucose is awesome, but both of those values only tell us what's happening in a fasted state. So some people can have a low fasting insulin, a low fasting glucose, and then maybe you give them a glucose challenge and their postprandial insulin, so how much their body releases in a fed state, is really abnormally high. And so that's hard to measure. Most labs are not going to do that. You can do like an oral glucose tolerance test with insulin, but it's just not very common. But if you do a glucose challenge, glucose tolerance test while wearing a CGM, that postprandial shape, your glucose response to that meal, is a very good proxy for how much postprandial insulin your body needed, especially that area under the curve. So how big that glucose response is. We're requiring insulin that whole time. So that's why I think it's very complementary to know both of those pieces of the puzzle.
And so when we're talking about postprandial, if people aren't familiar with that terminology, it just means post-meal. So for any of us that have been pregnant, you probably have been subjected to the horrible glucose tolerance test. For anyone that doesn't like really sweet things, you're subjected to this, load of, I don't even know how many grams of sugar it is.
75 grams, which is quite a bit.
Yeah. Right. Miserable. And then you get your blood taken multiple times. But for purposes of kind of talking through with the group, what are some of the things that can influence that postprandial reading, whether or not it's done, if you're sitting in a lab and you're having, labs drawn at like 1 hour, 2 hour, 4 hours post consumption of this glucose load, what are some of the things that can influence that?
Yeah. So like how high your response goes versus if it's normal, so a lot of that is an OGTT, oral glucose tolerance test, is actually one of the better measures for assessing insulin sensitivity and insulin resistance. It's not done that often unless you're pregnant. And so in the general population, unfortunately, it's kind of rare. But this is one of the few moments that we can capture that maximum glucose value. Like how high does your glucose spike? That's not really captured in any other traditional metric. Hemoglobin A1C is the average, fasting glucose is fasted. And when you're wearing the CGM, whether you're doing a 75 grams of glucose or if you're eating, eggs and sweet potatoes, we want to see how high does your glucose go, because that's also an important metric, even though it's missed in traditional settings. So typically, if you're eating just kind of like normal food and you're not throwing a ton of glucose at your system, we want to see that maximum glucose value below 140 most of the time. So this is really about repetition. I like to make it clear that if you hit 140 once, your system isn't going to crumble and fall apart. It's about making sure that's not part of our daily routine. So your go-to breakfast isn't spiking you to 140. That's a problem. So we want to adjust those things. If you were doing a 75-gram glucose tolerance test, we don't want to see it ever spike above that 180 mark. So above that, in my view, is starting to be a problem. And both with a large glucose load or a smaller one that you might be having at a meal, we want to see that come back down to pre-meal glucose values fairly quickly. So usually within 2 to 3 hours. But if you look at data on those oral glucose tolerance tests and they, categorize it normal glucose tolerance, impaired, or diabetic, the normal glucose tolerance, they peak in that first 30 minutes and then they're already coming down. And at 2 hours, we're back down to like where we started. So that's a nice, healthy response. Whereas impaired, not quite diabetes, maybe prediabetes, early signs of insulin resistance, we spike more at like the hour mark, maybe hour and a half, and takes a little bit longer. And then with diabetes, we spike really high and we stay up high for a while. So it's just like kind of amplified beyond that. So we're looking for similar things in just your day-to-day meals as well. How quickly did you come back down? I'd rather see you kind of go up and then recover quickly. That shows me that your cells are sensitive to the signal from insulin. It got the signal and it knew what to do with it and it recovered glucose. That's a healthy metabolic system. Whereas, if glucose is staying high for a really long time, especially from something not that crazy, maybe half a sweet potato or one slice of bread, if your glucose is staying high for a long time, that's a red flag. Because I say that as a caveat, even healthy systems, myself, if you do something that's a lot of carbohydrates and a lot of fat, like pizza or fried food or creamy pasta, any of those things, even a healthy insulin sensitive person is going to see a long, prolonged glucose response because you just overloaded your system with fat and carbs, and fat slows down that digestion and your carbs are running through your system for a long time. So you see that you're not necessarily insulin resistant, you just probably didn't make the best food choice.
And I think those macros are really important. I know even with fasting, we talk to patients about not breaking your fast with something that's carb heavy, that it's the time to have some light protein. It's the time to have some fermented foods. I mean, really kind of ensuring that you're not breaking your fast with just carbohydrates, because we know that that's going to, secrete more insulin to try to keep the blood sugar low. So let's kind of pivot and talk a little bit about like what happens in our bodies when our blood sugar values are not where they should be. Obviously, if we look at the bulk of the population, we know that most people are not metabolically healthy. They're overweight, they're obese, they're, I call it diabesity, that, so many of the population now is really metabolically not very healthy. So what happens to our bodies? What are the things that start to happen that obviously are not beneficial, but I think it's important for people to fully understand that before we kind of walk through the CGM and ways to kind of address this.
Yeah, absolutely. And real quick note on the breaking the fast, I 100% agree. I cannot emphasize that enough. This was something where it's like, oh, I had heard that's important. And then you see the data and you're like, it's really, really important. A daily fast and especially longer fast. No carbs in that breaking the fast, or else it's going to really reverse, all the good you just did. But thinking about consequences of these abnormal glucose values, if you're not diabetic, it's like, why should we care? And really the damage is done on both the microvasculature and the macrovasculature. So if we first kind of take like a zoomed in look at what's happening at the cellular level, a lot of what's going on is stress on the mitochondria. So mitochondria in our cells, they don't get enough credit. They do a lot, and they are really the site for all of these metabolic reactions. So they're processing the energy you're putting in to try to make usable energy. And when we flood the system with a lot of glucose, which is our quick, immediate energy, it puts a lot of stress on the cell and on the mitochondria. And it's basically like putting the gas pedal all the way down. It's gonna process that energy because that's its job, but it's having a lot of energy to process and it's kind of overwhelmed, which can produce free radicals and cause oxidative damage. So if you do this every once in a while, you have more carbs than normal on Thanksgiving or your birthday, it's not a big deal. We have systems in place to clean up that oxidative damage. clear out the free radicals. But if you're doing it every day, then we start to get in a cycle where the damage is more than the cleanup, right? So the short-term damage can't be fixed and reversed because we're damaging it again before the body has fixed it. So a lot of this has to go with like inflammation and oxidative damage, which we all know, inflammation is a serious problem, especially if it's on a chronic basis. And then those glucose spikes themselves, they are independently dangerous to our blood vessels. So we're meant to have a system that only has so much glucose in our bloodstream at any given point in time. Our bodies work really, really hard to keep that in a very specific range. And so when we spike that higher, like if you have a spike up to 180 or 200, then that can damage our endothelial cells of our blood vessels and cause an inflammatory reaction there as well. And that's where atherosclerosis, cardiovascular disease, really plays a part of diabetes, because it's damaging the blood vessel and then it's causing some inflammation so we can heal it. And then that repeated abuse is a cycle that we don't want to enter. And that's where if we have this combination of oxidative stress, inflammation, damaged endothelial cells, we get into this feedback loop of damage. And you're also calling on a lot of insulin every time you are stimulating glucose. So it becomes this, boy who cried wolf type of situation where you need insulin every once in a while. It's doing its job. Insulin's super, super important. But if you're calling on it every 2 hours when you eat, maybe a high carb meal 5 or 6 times a day, eventually your cells start to ignore that signal, and we can get into that feedback loop of insulin resistance at the cellular level, where it's starting to ignore the message. So the body pumps out even more insulin to compensate, and eventually it's just not enough. And that's insulin resistance with inflammation, with cardiovascular disease. And that's, all of that takes decades, which is why I'm really passionate about fixing it early and getting these devices on people, when they feel healthy and they feel fine, so that we can identify these are your daily trends. And this is where we need to adjust some things so that we don't get stuck in that feedback loop that leads to diabetes and heart disease and kidney disease. So that's it in a nutshell. Not to sound too scary, but it takes decades though, so we can fix that all if we catch it.
I think it's important for people to have a sense of what happens when we don't allow ourselves to be concerned about the choices that we're making. And I'm a huge advocate, as I know you are, about the preventative side of things. So when we're looking at it, I'm just curious, when we're looking at nutritional kind of mindsets and philosophies, are you seeing, I know there's lots of schools of thought right now, you've got carnivore and keto and low carb and paleo and vegan. Are you seeing, and obviously it goes back to bio-individuality, but are you seeing that it's skewed one way or another, that there's a more of a nominal impact on glucose with particular kinds of diets, if people are eating a whole foods kind of nutrient dense diet as opposed to a lot of processed? Because in every camp, maybe not carnivore, but in nearly every camp that I just talked about, there is junk food. There's vegan junk food, there's keto junk food, it's all there. So just because it has a tag on it that says it's keto or carnivore or what have you, doesn't necessarily mean it's healthy. But are you seeing certain nutritional philosophies that have a more negligible impact on blood glucose?
Yeah, and you touched on the biggest rule, which is whole foods. It has to be whole foods. Whole wheat flour is not a whole food. I want to emphasize, like, what is a whole food? It's as close to its natural state as possible. So that doesn't mean that cooking meat makes it not a whole food because we're processing it. So you can get into all these rabbit holes. But, as close to what it came in as possible is the best thing. And really, it is very personalized. Like you said, there truly is a no one size fits all. I've seen people be successful on all different types of diets and macronutrient ratios. But I would say, in general, because we live in an insulin resistant society, so we have so many people with poor metabolic health and that dysregulated feedback loop, for a lot of people, the lower carbohydrate, higher protein and higher healthy fats is going to be the best option.
Mhm.
There's always nuances to that, and there's always exceptions, but I would say that's the most successful approach for most people, especially if you're showing signs of insulin resistance or you're having, really abnormal glucose values. And I really like to focus on a nutrient dense diet and a diet that promotes satiety. So
Mhm.
often that's really prioritizing protein, fiber, non-starchy vegetables, if tolerated. That's a whole nother bandwagon caveat we could go on. But so in general, I want to make sure you're getting all the nutrients you need, you're feeling satisfied, you're not eating around the clock, which I know is something that you definitely agree on. And
Mhm.
if we're seeing signs of insulin resistance, we really do have to cut back on the carbohydrates. And there are some, we all have personalized responses to eating whole food based carbohydrates. Like how I respond to a sweet potato is not going to be how you respond to
Mhm.
a sweet potato. So it's also about finding if you do want to include carbohydrates in your diet, which you don't have to, it's totally fine if you don't. But if you do, finding which ones work best for your body as well. So let's try some, see which ones you respond best to uniquely, and then find the right macro combination to eat them in, the right portion size, the right meal timing to make those work. So sometimes, just tweaking the total amount a little bit is helpful. But in general, I would say like our modern recommendations for carbohydrates are way, way too high for almost everyone. The standard recommendations of up to 65% of your calories from carbohydrates. I've only ever seen that work in a handful of people, and they're all athletes for
Mhm.
sure. It's not, which this is the average recommendation for the average person, and it certainly doesn't work for the average person. So I would say most people do much better and closer to like 20 to 30% of their calories from carbohydrates, give or take. There's always the nuances, but
Well, I think it's interesting because I walk a lot of people through intermittent fasting as a strategy. And I think one of the things I quoted most recently was that the average American consumes 200 to 300 grams. And that's average. That means you have a lot of people doing way more than that, grams of carbs a day. And you think about just the beverages, like if but nothing else, you just track sodas and fatty coffees or sweetened beverages, people can hit that really easily. And if you're drinking your calories, that's like one thing that people can omit like automatically and just start tracking what they're consuming, because I think there's just this disconnect. And I used to say this to my patients in cardiology. I'm like, just because you could eat this way at 18 doesn't mean that at 50 you can eat like you did at 18 years old. Like your body doesn't need as much calories, you have less lean muscle mass unless you've been lifting and being really diligent. So let's pivot and talk a little bit about gender differences, because I know that there are definitely differences between men and women. And I think it's important to talk through that so that people can really make educated decisions moving forward. Like, we can't pretend we're mini men. I always say this all the time. Women are not mini men, and we can't pretend that we are.
exactly. We're really not. It's totally different physiological systems,
Hmm.
and we do have to acknowledge that it may be disappointing to hear. I know we all feel a little sad that
Hmm.
we can't eat the same things or do the same things.
Hmm.
But again, knowledge is power. If you know this, then you can compensate appropriately. So on average, unfortunately, women are definitely less carbohydrate sensitive than men. This is probably for a variety of reasons. And especially, as you age, that sensitivity difference between men and women only gets more pronounced. So this is likely due to differences in lean muscle mass.
Hmm.
So muscle mass is where we can store glycogen, which is our storage space of glucose. More space means you have more place to dispose that incoming glucose. And it's also, so it's just this huge sink for glucose, and which is why it's important for everyone to strength train. I'm a huge,
Hmm.
huge proponent of that. It's a wonder for metabolic health and just moving your body so that you can
Hmm.
utilize and stimulate some of that skeletal muscle. But on average, especially as we age, men tend to have more muscle mass than women. And so that's one particular reason. The others, of course, differences in hormones. So testosterone in general improves glucose uptake, and there is a well-established correlation between like diabetes and low testosterone in men. So there's a strong connection there. And in general, some of the hormones that women have more of tend to make it harder to tolerate carbohydrates and, a whole host of other things that go on there. So you can see this especially in, a menstrual cycle. So if you're still menstruating, you're going to have different glucose values depending on what time of the month it is. And this is something I really had never thought about before I started diving into this and wearing my own CGMs. It's so apparent because any change in hormones is going to affect everything. It's going to affect your glucose, it's going to affect your metabolic rate. So when we have major shifts in hormones each month, it's going to have an impact. So on average, and again, everyone kind of presents a little differently with this, but most women tend to have higher glucose values during the luteal phase. So weeks 3 and 4 between ovulation and menstruation, glucose values on average are just higher. So we tend to put out more glucose, but we're more insulin insensitive at that time. So this is just something for women to know. And if you are going to wear a CGM, wearing it for a whole month is really interesting, so you can see these differences. And for me, like, this effect is very pronounced, especially like that 1 week beforehand. And I tend to be just much more careful about lower carbohydrates, especially like towards the second half of the day when we're all already naturally less insulin sensitive. And so this is something I can now compensate with, but you don't know unless, someone told you or you have the information from your body. But a lot of women experience this effect. So it's very, very common. And I guess similarly with, menopause, after menopause, you are going to be less insulin sensitive. There's a sharp decline in estrogen, and that's an independent risk factor for insulin resistance and carb intolerance. So especially important that our postmenopausal women are really careful about how many carbohydrates they eat, what type of carbohydrates they're eating, when they're eating them, and that they know kind of where their thresholds are at, because you're just in a state where it's going to be a little bit harder to process that glucose as energy.
I think that's a really important distinction, just to mention that those that are still cycling, that, there are going to be periods in the month where you're more or less insulin sensitive. And then for women, as they make that transition into menopause, that they have to be more mindful. It's something that I talk very openly about. And I remind people, and again, it's like, I feel like I always get, normally when I'm at speaking events and I'm standing on a stage and I'm saying, I'm not really talking about grains and gluten. I'm talking about squash and sweet potato and, root vegetables and low glycemic berries, because we're such a carbohydrate focused culture. People feel, there's this lack. Like if you tell someone not to eat bread or not to eat cereal or not to eat lots of chips, they take it as like a personal affront. And really it's designed to say, hey, I want you to pick the most nutrient dense option, and just realize you probably can't get away with eating a whole sweet potato. It may be that you do half a cup of squash or half a cup of sweet potato, because your body is going to have to work that much harder to process that carbohydrate. Whereas you do much better with a higher protein diet, which helps ward off sarcopenia, which is muscle loss with aging, that unfortunately is a natural function of aging. And if you don't proactively lift weights, do weight bearing exercise, walk, etc., you're going to be even more risk. And the less lean muscle mass you have, the less calories you burn. So it starts this kind of, it's almost like a ball rolling downhill, that you really have to be much more cognizant. As unsexy as that is to say, as we get older as women, we just can't have as many carbs. And it doesn't mean that you don't ever enjoy a birthday cake or have a glass of wine, but you can't be doing it every night. And I'm not sure if you see this with your patients, but one of the things I see a lot of women in their 40s and beyond doing, and especially with COVID, because we have these like truly unprecedented times. None of us have lived through a pandemic, and there's just stress and demands on everyone that is unusual for them. You can't have a couple glasses of wine every night. I mean, that is like a surefire way to dysregulate your blood sugar, to raise cortisol, to dysregulate melatonin. So we're talking about all these different hormones. I'm curious, do you see that as well with your clients and your patients, that they start making these associations of like, oh, I really can't do X, Y, or Z anymore?
Yeah, and that's where I think a lot of people end up saying, I came here to try the CGM to learn about my glucose or see how things are going, and they leave as it's more of this was an accountability tool
Mhm.
for me, and this is a behavior change driver. We live in a society, and just as humans, that we love immediate
Mhm.
gratification, immediate feedback, right? Our brains are hardwired for that. And unfortunately, a lot of health habits that we want people to be doing and we need for good health don't involve immediate gratification. If I don't have that glass of wine tonight, or if I skip that bread tonight, I'm not really going to see the benefit for maybe like 30 years. That's a big delay. It's not
Mhm.
very motivating, and you're not sure if you're doing the right thing. And if you do have the wine and if you do have the sweets every single night, you're not really going to see the consequence either. The only thing you're getting is the immediate reward of it being satisfying.
Mhm.
Um, so I think the CGM and immediate data just coming right at you can help bridge that time gap. So you can see the consequence or the benefit of the decision you made right now rather than 20 years from now. And that's exactly what our brains want to see in order for something to truly be intrinsically motivating. And in
Mhm.
order to stick to a lifestyle plan for the rest of forever, we always switch things up, we're always changing what's working, but we want to stick to it long term. And in order to do that, it has to be intrinsically motivating. I can't tell you what to do and suddenly you're going to be motivated to do that. You have to see it and feel it and believe it. And I think the data is really helpful to do that, because you can see, oh, my glucose was way higher the next day when I had 2 glasses of wine. And that's very common. Like, with the effect of alcohol, typically what happens is you see a glucose dip in the moment because your body's prioritizing metabolizing the alcohol.
Mhm.
It's like, this is my first priority. So it's like, I'm going to worry about glucose later. And then the next day, fasting glucose levels are much higher. And postprandial, your meal responses, your glucose values are much higher as well, because you just kind of interfered with the liver's normal
Mhm.
flow. So you see those effects, and we have dietitians on staff to help point out those effects so that you can see, like, did you make this connection, and can I kind of help put it together so that it is intrinsically motivating and you can stick to something long term, because that's really my goal. You don't have to wear CGM for the rest of your life, but those insights will hopefully build a motivating plan that you can stick to. The last thing we ever want anyone to do is to have the, fad on and off, try this thing for 3 months, stop, and then kind of gain weight, cycle weight. That's not good long term. Like, that makes it harder to have a lasting, successful plan if we're always switching things. I think it's very
Mhm.
good to try things, but we have to stick with things over the long term in order to see the long term benefits.
Absolutely. I have to totally agree with you. Now, one thing we didn't touch on is how different types of exercise, and this is always a question. And in my monthly group, we're all focused on exercise the month of
Mhm.
December. How does exercise impact positively or negatively our blood sugar values?
Yeah. So overall, like, all exercise is positive. It's super, super important. You can't have perfect health without also exercising. But in the moment, your glucose may spike during exercise, and that could be completely normal. So it's really about how much energy you're demanding from your exercise. If you're in a fasted state and you're doing HIIT training, or you're doing, heavy weightlifting, you're probably going to see a glucose spike, just because the energy available circulating is not enough to power that quick, intense workout. So your body will stimulate some glucose for you to use. But it's different than a food spike, because you're using it right away.
Mhm.
It's fueling your workout. It's not just extra energy you put into your body. So don't be afraid if you see a glucose spike during exercise. That's totally normal. But after exercise, and really sometimes for up to 48 hours, we can see improved insulin sensitivity, especially strength training, but really any type of exercise has shown to be helpful for this. So not just improving insulin sensitivity, which helps require less insulin and to get your glucose down. So we're stimulating less insulin and getting glucose down faster. But it also can clear out some of that glycogen in your skeletal muscles and make sure you have more room to put some in if you are eating carbohydrates. And it can increase your mitochondria. So it makes it easier to produce energy and process all that glucose coming in. Really, the list could go on and on of the benefits of exercise. And so I'm a proponent of strength training, but I also say, do whatever you enjoy doing, because I want you to be doing it regularly. And whatever you can stick to on a regular basis is definitely more beneficial than if you hate strength training and you're forcing yourself to do it and you're not going to stick with it. So any type of exercise helps, and also making sure you're not sedentary. So we don't want to work out for 1 hour of the day and then sit the rest of the day, which, that's probably my Achilles heel, because I just work a lot. And so I sit on my computer a lot. So I totally understand how easy it can be to just be sedentary and go to the gym for 1 hour and think that's enough. But through the CGM data and through the research, it's very obvious that you also have to move and stimulate your muscles throughout the day. That can be a quick 10-minute walk, get up and just, I have a kettlebell by my desk to help remind myself of that. But just making sure you're moving throughout the day can also really improve glucose values, especially a quick walk after a meal. If your glucose is kind of rising, one of the best ways to help bring it down quickly is just to go on a quick walk. It doesn't have to be a run. It doesn't have to be a heavy workout. It can be 15-minute stroll around the neighborhood, and it makes a very meaningful impact.
I was about to say that's like one of my favorite things to suggest. Like it doesn't even matter if it's 5 minutes, 10 minutes, 15 minutes, 30, take your dogs out, get some connection with nature. I know that you're in a warmer part of the country, but one of the things that has been beneficial during COVID is I've just been doing more walks with my dogs in my neighborhood. And I've actually grown to really appreciate it, because much like to your point, for those of us that are at home working, you get in this habit of, oh, I'll just get one more thing done. But really what you need to do is stop, get up, move your body, then come back. And then I always feel like that makes whatever task I have to get done that much easier. Now, before we kind of end things today, I want to make sure we touch on two more things. Obviously, intermittent fasting is a strategy that I utilize myself. And ironically enough, I actually had a longer fast than what I normally do earlier this week in preparation for a colonoscopy. I had to go 40 hours, and I was so excited because I was like, okay, this is the first time I've done a fast that long in a long time. But I then had to take medication to prep me for the colonoscopy, which is very sugary. And all I could think of was it's going to take days for my body to process the amount of glucose I just ingested. In fact, I told my gastroenterologist they have to come up with better options for people.
Yeah.
But let's talk about the impact of fasting and blood sugar for like a healthy average person. What are some of the benefits? What are some of the things that you see? Because I think there's always this concern for people. The fear is always, if I don't eat, my blood sugar is going to drop, which I just have to remind them that our body has all sorts of amazing emergency backup systems to ensure with homeostasis that doesn't happen. You mentioned glycogen stores and things like that will help maintain that blood sugar, but let's talk about the impact of fasting and blood sugar.
Yeah, and you're absolutely right. A lot of people are afraid of becoming hypoglycemic if they fast. And I'll tell you, that is very, very uncommon, especially in non-diabetics. So it's extremely rare. We have lots of systems in place to make sure that doesn't happen. And if you are wearing a CGM and you're a little nervous to fast, it's the greatest time to try it, because we know what's going to happen. And you also have, support there through our team. But fasting is one of our core pillars. So we talk about how nutrition, fasting, exercise, and stress. So I lumped stress and sleep and anything that's a stressor in one category. Those are kind of like the four legs of a chair. If we want good metabolic health, we have to do all of those. So I'm completely in agreement with you that fasting is super important. So as general golden rules for most people, because again, fasting is personalized just like nutrition, I really like to emphasize at least 14 hours of fasting a day. That's like a bare minimum for everyone, even my diabetics. They're 14 hours, and really aim for at least 3 hours of fasting before bed. We are universally less insulin sensitive in the evenings than during the daytime. This is everybody, everyone has this effect. So earlier dinners, align our eating with our circadian rhythm is a good golden rule. So some people, that 3 hours before bed is enough time. And for others, they really don't see those overnight glucose values and those morning fasting values come down unless it's 5 or 6 hours before bed. So we might have to move that, further up, but 3 hours minimum. And then we just want to avoid grazing. So I really want people to be conscious about how much time is between their meals. This is personalized because, everyone's a little different, but make sure you feel satiated after a meal so that you can go, in between meals without having to snack all day. Because if we're grazing all day and we're constantly having snacks between meals, then we're always stimulating insulin. We don't want to start that cycle, that feedback loop where we're constantly stimulating insulin. So those are my, core rules for the general person. And from there, we can really, take it where we want to take it. So there's the caveat of, the people that fasting is not applicable for. I'm sure you've talked about this before. So pregnancy, if you're underweight. But again, that's not most people. And then beyond that, really, one thing that I will note is this was a disconnect from my traditional teaching. And when I started to see lots of people's data, was that if you are insulin resistant or you are already at the stage of maybe a diabetes diagnosis, fasting is one of the most useful tools we can lean on to get you back down to normal. So for an everyday healthy person, general 14 or 16 hours of fasting a day is probably just a good, healthy practice. But for those insulin resistant folks, we can decrease their glucose spikes by altering diet. We can lower their glycemic variability by altering diet. But we can never get your average glucose values and your fasting glucose values down to optimal ranges without leaning on fasting heavily, because your liver has really dysregulated that ability to maintain good glucose values in a fasted state. So no matter what we're doing diet-wise, we can't fix that unless we force the body to go without food for a little while. So we have found, kind of longer fasts for the insulin resistant people to be just an amazing tool of finally bringing those fasted glucose values down. So we first want to address diet and make sure, we've got the spikes down and that they're not on any medications where they might be hypoglycemic. But those longer fasts have just been amazing for that category of people.
Let's talk about the state of metabolic health, which I think we would both agree is at like a crisis state. We know that only 7 to 8% of Americans are metabolically healthy. Even worse, 80% of us are unaware that we have prediabetes. What do you think is contributing to this? What are your thoughts, as a clinician, as someone who's, been on the ground, taking care of patients that are not metabolically healthy? What do you think are the biggest contributors, especially over the last 3 years?
Yeah, it's certainly not getting better, as you mentioned, although I remain optimistic, so we can kind of tie that in at the end. There's this minority of people who care a lot about this, and they're growing louder and louder, and there's lots more information out there, podcasts like this, information that are reaching what I would consider the average person. So I've started to see just more people start to become interested. So I'm optimistic that maybe if we touch base again in 5 years, we might be saying a different narrative, but that's it's slow and steady, takes time. Where if you look at a broader population, there's certainly, we're in a really, really poor state of metabolic health overall. As you mentioned, it's certainly less than 10% of the US population as a whole is considered metabolically optimal. And a lot of people are unaware. I think there are many things that are leading towards this. One is that we just live in a more and more obesogenic environment. We live in an environment where everything is easy, where our predisposition to be lazy and to consume hyperpalatable foods is overwhelming. And if you aren't highly motivated to break against some of these barriers, and if you aren't disciplined, it does require discipline, which I don't think is something a lot of humans are necessarily excelling at, then it becomes really challenging. We have a million different ways to avoid expending energy. We can drive to basically everything. We can take the elevator, we can take the escalator, we can do all of these various activities to minimize energy consumption. We can turn the lights off with our phone. We can turn the AC off with our phone. So we don't even have to get up off the couch if we don't want to. And then with the food environment, everything is hyper palatable around us. So it creates this perfect storm where it's really, really easy to overeat and overeat the wrong foods and overeat them all the time at any hour of the day. So all of these things combined, in addition to, I think what's really happened in the last few years is increased stress, which only escalates these things. So we're getting worse sleep, we're really stressed as a society, and that makes these temptations or these things that require a little bit of discipline and intentionality even more challenging.
Yeah, I couldn't agree with you more. And it's interesting. I was at a family wedding, and because of the pandemic, we have not had this very large Italian family together in many years. And so, my teenagers who have now gotten really tall are not recognizing half of the family because we just haven't all been together. We're kind of dispersed all across the United States. And it was really interesting to have conversations with people of differing age groups. So obviously my parents' generation, my generation, my younger cousins and their children, and everyone's speaking the same or echoing the same concepts and concerns that, why are we becoming increasingly unhealthy? Why are we seeing younger people with diabetes, and not just autoimmune type diabetes, but metabolic health type diabetes, which we know type 2 is really a lifestyle related issue. And it was interesting. My older cousin is actually a physician. And I said, don't you remember back when we were in school, like a million years ago, that the thresholds for glucose, as an example, were much higher? Like you didn't really worry, and I'm going to put this in air quotes, worry until you saw a blood sugar of 140, that was the worrying, concerning kind of modality. And yet now we're understanding that sometimes lower is better. And in prep for our podcast today, one of the things that I kind of refamiliarized myself with was really looking at the nuances. And this is where, I'm directing the conversation. We're going to start talking about, home monitoring devices, glucometers, continuous glucose monitors. But the statistic of those with glucose levels of 90 to 99 milligrams per deciliter, so this is not considered to be diabetic yet, are 3 times greater risk of developing, I'm like tongue-tied, of developing diabetes versus levels of 83 milligrams per deciliter. And Dr. Robert Lustig, who I know our communities are both familiar with, mentioned that he fervently believes when you see a blood sugar greater than 100, metabolic syndrome is in full force, and a fasting glucose over 90 is questionable. Now, that is something that Dr. Lustig talks about in his book, Metabolical. He's been a guest on the podcast. But I think for a lot of individuals, that's shocking. They think they're safe if they're under 100. And what we're seeing from the research is 100 is not optimal. It's really understanding that we want those fasting blood sugars to be lower than that. And would you agree?
Yeah, absolutely agree. And there is a lot of research to support this, despite the fact that maybe it's not as well known or the guidelines haven't changed yet. I'm also optimistic that one day they will change, but they tend to be very lagging, those types of changes. And that's to add to the problem we're already talking about of our environment is also then, the healthcare system has its own challenges that do not help the environment issue that we're in. What I see over and over with the clients that are coming to us is that they reach that threshold of prediabetes, or they're really close to that threshold, and their primary care was like, okay, well, we'll recheck you in a year, keep eating well and exercising, and we'll watch it. Where that is the perfect time to really get serious and say, you're in a state of metabolic dysfunction. Right now is when we really need to make some serious changes, and you lay everything out and you start, making any sort of big lifestyle improvements that you might not have done already. Whereas the narrative is, oh, okay, well, you're not quite diabetic yet, so we'll just monitor it. That's the story we hear over and over. It's not a one-off example. And so that's part of the problem as well, is that we don't take things seriously when they're in that pre-diabetic range. And then those ranges itself are even not set for what's optimal. So there's so few people who are knowing what numbers they should be at to be really optimal. They're tracking that, and then they're like being proactive about it. So that's a narrative change that I think has to, happen within either the healthcare system, or we keep encouraging individuals to be advocates for themselves and go the more consumer-led route, which is eventually what I decided to do after the frustrations within the healthcare system. But they're all related, and related to the actual number. We really recommend getting your fasted glucose value below 90, because there's such strong evidence to suggest that you're going to be better off if that's kind of where you're sitting.
Yeah. And I think it's important for people to understand that, knowledge is power. And so a part of my desire to have this conversation with you is to help people be their own best advocates, because I recall in the early 2000s, the university system that I worked at, there were obviously a lot of postdocs, people that came from other countries that were MDs or PhDs that were doing postdoc research. And there was this lovely Australian gentleman that I became friends with. And I remember him saying to me, I don't know what it is about the United States, but you guys do a really wretched job with prevention. Really wretched. You wait for your patients to get diabetes. You wait for someone to have full-blown asthma where they need steroids to control it. He said, I don't understand why you all don't do a better job. And at the time I was like, I didn't really know what to think of that. But retrospectively, thinking back, he was absolutely correct. And so it sometimes takes mainstream medicine 20 years to catch up with the research. So I want everyone that's listening to understand that is why these kinds of discussions are important, so that you can take the information to your doctor, your NP, your PA, whoever you see, and just say, I'm concerned about my blood sugars being in the 90s or the low 100s consistently. This is a problem. What can we do to help? And I think, part of our discussion today, we'll be talking about knowledge is power. And so let's talk about the differences between a continuous glucose monitor versus a glucometer. And so for people to understand, these are things that these are devices you can have in your home. I have both. And I think it's incredibly insightful, but there are some important differences. And so that's where I think this conversation is a great kind of starting point to help people understand, how do they work differently? What different types of information do you get from the devices themselves?
Yeah, certainly. So there are pros and cons of both. If we start with kind of even more, what is traditional, what are people classically getting? It's maybe a blood draw once a year where you're getting a fasted glucose level and hemoglobin A1C. Once again, if you're doing nothing, at least do that, at least get some labs at least once a year. That will tell you a little bit of information. I always have my shtick about the flaws of a hemoglobin A1C. It tells you your average glucose over the last 3 months, but it's estimating that based off of how much glucose has been stuck to your hemoglobin molecules, which last on average 90 days, but not everybody's red blood cells actually live 90 days. And so there's some flaws there where you could get a little bit inaccurate highs or lows. And then the other flaw of an A1C is that it's just giving you that average. So your glucose could be swinging up and down all day, and your average could be good. And it's still a good proxy for kind of how your glucose is doing. It's better than nothing. It's certainly, if it's very high, that is telling you something, but it's not as good of information as something that you can get from a glucometer or from the CGM. So then kind of the next step up is we could talk about the glucometers or the glucose meters. The major pro of these is that they're cheap and they're readily accessible. The cost isn't insignificant because you do need to buy glucose strips to keep doing readings, but you can go to any CVS, Walgreens, Amazon, and get one of these devices. And then essentially, what you're doing is you're pricking your finger, you're drawing a drop of blood, and then you're seeing what that glucose reading is in real time. So major pro is you can take it with you anywhere. You can do that drop of blood wherever you want, whenever you're curious. The major con is that you do have to prick your finger. This is a barrier for a lot of people. Can't tell you how many diabetics I worked with before CGMs were a little bit more common, where they just would not do it. And we never knew what their glucose was. because it is a little uncomfortable. For some people, it's no big deal at all, but it does tell you a lot of information. So the major pro there is that you can kind of check what your fasted glucose is each morning, and you could do that for 10 days, and you could see what a trend is. Because as you were mentioning, one fluctuation, one bad day where your fasted glucose value is higher does not necessarily mean that it's consistently high. If we get a bad night of sleep and then you check it in the morning, I promise you your fasted glucose is going to be higher than normal. But hopefully that bad night of sleep was a little bit of an anomaly for you. And when you get back to a normal sleep routine, you see that your fasted glucose improves. So there's a huge convenience factor with the glucose meters. And then the next step up is the continuous glucose monitor, or the CGM. And what this is doing essentially is it's reading your glucose 24/7 for 2 weeks straight. So the major pro for the CGM over a glucometer is that you're getting that movie picture of your glucose versus the photo snapshots. So instead of maybe trying to estimate how your glucose responded to a meal and you prick your finger an hour or 2 hours afterwards, and you kind of guess what happened in between that hour or 2 hour, you can actually just see that exact curve. And so you're going to learn a lot more, much, much quicker when you see a movie versus a picture. So I always guess that what you probably can learn in 2 weeks of wearing a CGM probably takes at least 100 finger pricks from a glucometer. The major con, of course, is that they're more expensive. The hardware itself is just more costly. It's a more complicated device. And so there is a price factor there. But the trade-off, again, is that you'll learn a lot more, much, much quicker, and you don't have to prick your finger at all. So it stays on the back of your arm for that full 2 weeks. It's truly painless. It's very comfortable to wear, and you get that data kind of real time without having to do any blood draws.
Yeah, and it's really interesting to me because I'm one of those people, I hate pricking my finger. And I had plenty of patients who would tell me the same thing. I hate it. I hate it. I hate it. And understanding that you get a much broader bit of information from a continuous glucose monitor. And I speak very openly that I would not have known, even as someone who's low carb, high protein diet, there are specific foods that are healthy. I mean, like a plantain's not an unhealthy food. It doesn't matter how I cook it. It doesn't matter what macro sequence I eat it in. It spikes my blood sugar, and not just a little bit, substantially. And I don't feel poorly. So it's not like I'm getting sweats or anything else, or I, feel sweaty or anything. And so, for me, it's very interesting to see that complex interrelationship of nutrition, sleep quality, stress management, exercise, because we can certainly speak to the fact that you can see changes on the CGM when you're exercising. Maybe you're running a race, maybe you're really pushing yourself, maybe you're doing high intensity interval training or very, very complex strength training, and your body's really in a position where it's trying to free up extra stored glycogen to be able to utilize. So I guess one of the most common questions I received in prep for our discussion today was, and because my listeners know that I think checking a fasting insulin is critically important, they're like, why are we measuring glucose but not insulin? Is that something that will eventually come to pass, or is it just so much easier to measure glucose in the blood versus insulin?
Yeah, from a technology perspective, it's much, much easier to measure glucose than it is to measure insulin. So glucose is, a metabolite that's freely circulating in the bloodstream, where insulin is a hormone. In the assay, even to do, a fasting insulin versus a fasting glucose level is a lot more complicated. That's why you can't do the point of care either with insulin. With that being said, the technological advances are very impressive. And I know there's a lot of R&D currently happening to measure not just insulin, but a lot of other interesting biomarkers. So I'm certainly confident that at some point in time, we'll have continuous data streams for more than just glucose. The timeline of that is, who knows, but it will happen one day. And so I think in an ideal world, we would be measuring, continuous insulin. We would be measuring some other factors as well. But glucose does tell us a lot about our health. I kind of think about it as the 80-20 rule, where what information is really going to shape some of these core healthy behaviors and really drive our health in the right direction. And glucose is telling you a lot about that. If you want to drill down even deeper, we certainly want to complement that with other things. I never recommend that the only thing you ever pay attention to is your continuous glucose values. That of course would be missing some of the bigger picture. But most of the time, things that are going to be driving us towards an insulin resistant state is going to be reflected in the glucose values, and it's going to serve as a behavior change proxy in the right direction.
Yeah. And I think that's really, why I think CGMs are so valuable is it can allow people to make decisions like, maybe I really do need to sleep more. Maybe I need to do less cardio and I need to do more strength training or zone 2. Maybe I need to eat less carbohydrates. It's being able to see that if you sit down and have a meal of pasta, the net impact on your blood sugar versus a steak and broccoli. And so this is like a perfect pivot into talking about macronutrients. And so, I've had the honor recently of interviewing Glucose Goddess, and I think she's done a beautiful job helping people understand that you don't want to eat your carbs naked. And for you being on the, the kind of founder side and also being a registered dietitian, what are some of the common things that you will recommend to patients or clients when you're counseling them? What are some of the pitfalls when they start monitoring their blood sugar and they realize, oh, well, maybe I need to have carbohydrates after I've had some steak or after that broccoli? Maybe that's the time to include, pasta or rice, if that's within your realm of possibility, depending on your nutritional paradigm that you embrace.
Yeah, that is a great way of wording that. When it comes to macronutrients, carbohydrates, of course, is going to be what are influencing your glucose values the most. And most people come into this assuming that they're going to have to completely eliminate carbohydrates from their diet. And that's usually not the case. As you mentioned, a lot of times this is just giving you knowledge. Knowledge is power, and it's informing you with the ability to make more mindful, intentional decisions. So for a lot of people, what we end up kind of working towards is figuring out their unique carbohydrate threshold. It's how many carbohydrates can you consume and maintain good glucose values, good energy levels, and what types of carbohydrates and different strategies do those work in. Of course, there's always the golden rule I want everyone to remember, which is we really want to, no matter what, whether it's carbohydrate, protein, or fat, focus on more whole foods, minimally processed, nutrient-dense items. That rule does not change no matter what we're tracking or paying attention to. But when it comes to carbohydrates, it really runs the gamut of how many carbohydrates an individual can consume and maintain those healthy levels. So for somebody who is completely sedentary, not doing any strength training, very minimal lean body mass, maybe they're older, they're probably going to have a very low carbohydrate threshold. They're probably not going to be able to consume very many carbohydrates at all. We might be able to increase that threshold over time, but they're likely going to start with kind of a lower base. Similarly, with someone with insulin resistance or type 2 diabetes, even, their carbohydrate threshold is going to be very low because they no longer can fuel partition correctly. Whereas somebody who's an athlete, young male with lots of lean body mass, they probably can consume a lot of carbohydrates and maintain great energy levels and great glucose values. So it really differs. And that's why, there's really no one size fits all optimal diet, optimal macronutrient balance. We need to find that sweet spot. And then within the greater total carbohydrates amount, we also need to figure out which carbohydrates you personally respond best to as an individual. As you mentioned, the plantain example for you personally, those are things you just don't know until you see the data. You could be as knowledgeable as possible on this subject, but until you've actually tracked your own data, you don't know those little nuances. Everyone's going to have a high glucose spike to soda, to juice, to instant oats, things that are really processed. But for me personally, I have a very low glucose response to bananas and then higher to other fruits, which is a little, counter to the normal glycemic index scale. So it's those little nuances you start to learn about yourself that you can then make good trade-offs. maybe I have a really large glucose spike to rice, but I don't really like rice. Then it's like, well, probably won't consume it unless it's in, a really good dish somebody's making for me. Whereas maybe I love bananas and I suddenly learned that they're actually okay. I can consume them a little bit more freely than maybe I previously might have thought. So you can kind of make those trade-offs. And then the final part is the hacks part. And so you've learned kind of your unique responses. Maybe you do have higher glucose responses to rice, but you love rice. You're like, I don't want to get rid of rice as part of my diet. So then we start to introduce, what are the hacks that can make this a little bit better for you? And it's usually the no naked carbs, as you mentioned. So consume some protein and fat before you eat that carbohydrate. So if you're eating the rice with a piece of steak, eat some of the steak first and then move on to the rice. Try to avoid carbohydrates, especially those you don't tolerate that well, towards the evening. So you might want to only have it at lunch and not at your dinner meal, and especially not if your dinner is kind of a little bit later in the day. And then pair it with exercise. So maybe you normally do a morning workout and then you have your favorite fruit and protein smoothie and you have a low glucose response. But if you skip your workout, you're going to have a higher glucose response. So then maybe you go with a totally different meal if you know you missed your workout. So timing things around like exercise, other macronutrients, and then the time of the day are some of the big hacks where you can kind of make those different foods work for you.
Yeah. And I think that's really helpful for people to understand. We're not advocating that you never consume your favorite food ever again. We're just saying be conscientious about when you choose to do so and embody some of these suggestions. I find for a lot of patients, they're surprised to know that they're more insulin sensitive during the day and less so at night. So I always say when it's light outside, you can get away with a whole lot more than you can at night. Number one. I just recently learned about soleus push-ups. So when I have patients who tell me I don't have time to exercise, I'm like, you can still do a soleus push-up. And so for listeners, Glucose Goddess did actually talk about this, and there is actual research around it, but you can literally be sitting at your desk and be flexing your calf, and to be doing that, several times an hour, and you actually have some degree of glucose disposal. So understanding that for every excuse I've heard, I always try to come up with some way to be able to meet people where they are. But those kinds of easy things, we can walk after meals, timing your carbohydrate intake, making sure you're not having a big bowl of pasta all by itself. I think those are really reasonable things. So we just say, okay, just change one or two other things, and then it will have less net impact on your blood sugar and overall metabolic health.
Yeah, absolutely. And to your point about movement, little movement makes a difference. So it doesn't have to be this 1.5 hour workout if you don't have time for that. It doesn't have to be a 3-mile walk. A little bit of movement makes all the difference. So I live in Phoenix, Arizona. We're entering summertime here. It's a little hot. So normally I like to go on at least a 15-minute walk after each meal, just kind of map that out. But in the summer, I'm not going in the middle of the day when then I need to jump on a work meeting right after, because I will be sweaty, guaranteed. It gets to, 120 degrees here. So instead, I just do a quick set of body weight squats and push-ups in between meetings and after meals. And that works. That's some movement. That's for my body's way of kind of circulating and picking up some of that extra glucose, stimulating my muscles. Like you're mentioning, there was that study that came out of that, like calf flexing. Those little things actually matter. So if you can build that into your routine and just make it a habit that you don't have to think about, those are hacks when the environment's not great either. I know I have to deal with hot summers. Some people have to deal with really cold winters. You can also get one of those if you work from home. A lot of my coworkers have the standing treadmill desk, little walking desk. So those are helpful hacks too. There's always a workaround.
Yeah, absolutely. And I guess one of the things that I find utterly fascinating about the human body is when we're talking about the role of movement after eating, perhaps we can touch on what's actually happening. Like our skeletal muscles really are these glucose disposal units, if you want to think about it that way, and helping people understand this is one of many reasons why I know we both advocate that people strength train throughout their lifetimes, that they maintain muscle mass, which maintains a degree of insulin sensitivity, and how important that is. I would say it's not just about body composition. It really is about metabolic health.
Yeah, absolutely. Exercise, lean body mass, and movement in general are some of the most powerful tools, not just for insulin sensitivity and metabolic health, but for longevity overall. It pretty much is going to have a positive ripple effect into every kind of area of health that you can think of. So it's one of the most important tools in our toolbox. But when it comes to glucose specifically, over 80% of our circulating glucose ends up getting picked up by our skeletal muscle. And so if you think about that, anytime you're stimulating your muscles, so that's why a little bit of stimulation can go a long way. Some walking, some movement, cleaning your house, doing various errands, chores, all of those things are helpful. And then also building up that skeletal muscle provides more of a sink for your glucose to go towards. And so if you think about skeletal muscle as kind of your savings account, it provides that extra level of security that you have kind of a backup if you want to be a little bit more flexible. Maybe it's your birthday or it's your significant other's birthday and you're going out to eat and you want to indulge. Having some of that extra bit of lean body mass on your body is protective in those kind of situations and allows you to be a little bit more flexible. But then stimulating your muscles as well, moving around kind of helps stimulate some of that glucose pickup that is happening.
And do you recommend that your patients and clients strength train several days a week? What is your usual kind of set of recommendations? Because I think most women in particular love cardio and they want to do cardio all the time. They want to run 10 miles every day. They don't want to pick up the weights. They don't want to do zone 2 cardio, but yet we acknowledge that each one of these can be very important for overall metabolic health.
Yeah, so it certainly depends on where you're starting from, so if you're doing no strength training right now, trying to get an hour in the week is a great place to start. Start small, start somewhere where you think is actually realistic for you. So maybe that's 1 hour session a week, if that's all you can manage, if you love cardio and you don't want to get rid of it completely, or if it's 2 30-minute sessions a week, that's helpful. You can do an upper body day and you can do a lower body day, or, you can do a full body movement. The great thing too is there are so many apps and YouTube videos and tutorials and things you can follow if you have no idea what to do. There are many resources out there to help guide you, or hire a personal trainer if you're worried about kind of an injury or doing something incorrectly. There are certainly things to overcome that barrier as well. But I think sort of an optimal dose for a non-athlete, just a person who's trying to live a healthy, sustainable life, is to try to get strength training in 3 to 4 times a week. So at least a 30-minute session, ideally closer to an hour session, is what I would consider pretty optimal amount of strength training for most people. And then include some, aerobic activity in addition to that, both at more that zone 2, a little bit of zone 5. And then I personally think it's really helpful to try to do something that has coordination required in it. If we're really talking about the kind of the optimal workout routine, if you're stacking some of these things. So whether it's playing sports that require a little bit more coordinated movement, or it's dance or something, more along those lines, there's lots of classes that require coordination. If you want to do more of a class version, this kind of helps stimulate both cognitive function and physical ability. Learning new movements, learning new physical skills is kind of helpful for that overall health as well.
Yeah, and I think it's interesting in prep for an upcoming podcast with a brain researcher. He talks about in a recent book doing things like pickleball, that it's important to have this hand-eye coordination, how important that is. And when I told my husband, because pickleball seems to be a thing right now.
It's a thing, yeah.
Have never even played it, but we were in a city recently where they had this whole pickleball tournament that was going on. And I said to my husband, is this what middle-aged people do for fun? Is this now the new thing? But understanding that, those sports activities, all those things like hand-eye coordination, we want to continue to stimulate our brains and not just our bodies throughout our lifetime. What is unique about zone 2 training? Because this is now something that I think has become much more mainstream. You hear a lot of podcasters and physicians talking very openly about how important it is to find some balance. So don't just go out and kill yourself doing HIIT, which should not be an hour long. It should be 10 minutes, helping people understand how important zone 2 training is for our health.
Yeah, absolutely. And speaking to doing excessive amount of HIIT, I have seen this so often where women come to us and they're eating one meal a day. They're eating almost no carbohydrates. They're doing HIIT every single day as their go-to workout. They're doing sauna, they're doing cold plunge, and their body is in stress overload, and their glucose values are skyrocketing to each of these stressors because they have filled their stress bucket too high and it's overflowing. That's kind of this idea of hormetic stressors are good, but the dose makes the poison, and we can certainly overdo it. So I don't believe that HIIT every day, all day is the solution either. If you're going to do only one thing, I always just recommend strength training. But if you're looking for the optimal routine, adding in that zone 2 can be really helpful. And really the underpinning for the why behind that is mitochondrial health. And so zone 2 really stimulates healthy mitochondria. And as we all learned in 6th grade biology, mitochondria are the powerhouse of the cell. So metabolic health in general is just our whole complicated processes to balance energy, and really each individual unit that's powering those energy sources is our mitochondria in our cells. And so when we can keep those really healthy, that helps drive good metabolic flexibility. So the ability to utilize fuel when is appropriate. So sometimes fat is appropriate, sometimes glucose is appropriate, sometimes ketones are appropriate. And so having healthy mitochondria help our body to understand when we need to be utilizing different fuels and switching appropriately and quickly, so that we have that optimal energy system. And zone 2 really trains that, and also stimulates what's called mitophagy. And so autophagy got really popular. Mitophagy is the same thing, but for our mitochondria specifically. And it's kind of that healthy cleansing, that repair system for that organelle specifically.
Yeah, it's really important. And I'm so glad I call it the triad. When I see women that are over fasting, over restricting, over exercising, and hormesis is a good thing, but it's beneficial stress in the right amount at the right time. And I find more often than not that people fall into the habit of not eating enough and thinking if they're weight loss resistant, if they exercise harder, longer, more strenuously, that somehow that is going to be the antidote for what they're struggling with. And I think that in many ways, this is where a CGM can, if someone's saying to me, like, I just always see these high blood sugars and I'm 120 pounds, I don't understand why this is happening. Helping them understand that if your body perceives that there is too much stress going on and your cortisol levels are up, well, guess what happens? Your blood sugar also goes up. And so that glucose will go up, and it can show up on that CGM. It can show up in many other ways, but understanding that, this role of hormesis or hormetic stress and people that are just, it's like the extreme of everything. I have to sit in an ice bath for an hour, and I have to do all the infrared sauna, and I have to do all these kind of strenuous activities, whether it's just to prove themselves they can handle it, or they, saw someone suggesting that 1 minute of cryotherapy or 1 minute or 2 minutes of cryotherapy is beneficial. And it is, but in the right person at the right time. And so I'm so grateful that you brought that up, because that's definitely something that I've seen in kind of the fasting space, that there are a lot of people. I always say, fasting is good to a point, and then it can become detrimental if you're doing too much of it, with too much intensity at the wrong time. And this is a segue into talking about women in particular, because there are gender differences when we're looking at CGM data. And so when you're talking about younger women, 35 and under, that have a menstrual cycle, what are some of the insights that you and your colleagues are seeing in terms of follicular phase versus luteal phase and insulin sensitivity?
Yeah, absolutely. We do see a lot of gender differences across the board. I think it was Stacy Sims who said women are not small men. So we have a different biology, we have different hormone system, and we respond differently. So specifically just the regular monthly menstrual cycle, we do see variations in glucose values at different times of the month. And so this will always be a little bit personalized to the individual of how much they see this effect taking hold and kind of their unique little nuances. But typically what we see is that we have higher glucose values during the luteal phase. and then lower glucose values during the follicular phase. And so usually the reason for this is, of course, the hormonal changes that happen during this. So during the luteal phase, it's not a perfect hormone fluctuation, but we tend to have lower estrogen during that time, and then progesterone is peaking. And that just normally naturally makes our body a little bit more insulin insensitive. So we tend to have those higher glucose values, a little bit higher responses to maybe foods you normally tolerate well. And this also tends to be the time where we have our classic, PMS symptoms. So it kind of is an amplified effect where we're a little bit more higher glucose values at baseline during this time. And then it's also a time where women tend to have a more difficult time sleeping, more cravings, kind of mood swings, bloating, all of those things coming together, which maybe then lead us to reach for foods that are not as optimal for us. And then we're seeing that even more amplified effect. So a lot of times just the awareness of this change helps women make better decisions. When you see, oh, it is my body just doing its normal changes, normal physiological processes that are resulting in some of these emotional changes or glucose changes, then you don't feel like you're doing something wrong or something is wrong with you. You see it and you're like, okay, this is normal. This is expected. And that tends to empower women to just make better choices where, this craving is just because I'm in this part of my cycle, so I'm not going to give into it. So a lot of that is kind of knowledge is power once again, where that awareness tends to lead towards better decisions. But then on the flip side, in the follicular phase, this tends to be when we are more like a man in that we tend to be able to put on muscle better during this phase, exercise harder, we have better glucose values, insulin sensitivity. And so that's also powerful to know. If you are really into strength training, a lot of women will hit their PRs during this phase, and maybe they'll have to drop some weight during the luteal phase. And knowing that that's okay, these are normal fluctuations, is also really empowering.
Yeah. And it's interesting because I've always advocated that women not fast the week prior to their menstrual cycle, and understanding that this is a time to be a little more gentle. You may need a little bit more discretionary carbohydrate, understanding that a potato is not going to get you in as much trouble as sitting down and having like a massive brownie sundae that is really going to skyrocket your blood sugar, and helping women understand that if they're noticing that there are changes throughout the month in the gym, we're really at the beck and call of our hormones. Really, that's what it comes down to. And that's normal. It's not abnormal. Now, on the other side, women that are in perimenopause and menopause, so women that are 10 to 15 years out of menopause, late 30s, early 40s is when it's starting, or they're in menopause, you probably are also seeing some changes, and women are losing insulin sensitivity as they're getting into those perimenopause years for a variety of reasons.
Yes. So there's a lot of research to back up that menopause is an independent risk factor for insulin resistance and high glucose values, especially high fasting glucose values. And a lot of this is due to that decline in estrogen. And unlike our menstrual cycle, it's not coming back up. It's going to stay declined. And so what we really need to realize here is that might mean that what worked for you before menopause is not going to be what works for you after menopause. And again, that's okay. It's not that you're doing anything wrong. It's not that you've done something bad. It's just a natural, normal physiological changes where now maybe we need to adjust what we're eating a little bit to match this new normal. And so a lot of times, what we're seeing and what the research shows is that there's this decrease in glucose disposal, glucose effectiveness when our estrogen is lower. And so I think it's estimated that insulin sensitivity can decrease by 30 to 50% when we're postmenopausal. And so because of this, usually we tend to have a lower carbohydrate threshold at this point. So as we were mentioning before, it's really about finding your personal carbohydrate threshold, and your personal threshold can change throughout life as well. So this tends to be a time where you just don't tolerate carbohydrates as well as you used to. And it might be that low carb is what works for you all the time at this point. And low carb, again, is broad on purpose because what's low for somebody is a little bit different for maybe somebody else that's also still considered low. The other thing that's really important during this time is needing even more protein than we needed before, because we're having higher protein turnover, less protein synthesis ability. And so we need to increase our protein demands in the protein we're getting from our food even more than we might have been doing before menopause. So that's kind of like the trade-off is we might need to decrease carbohydrates and then think about increasing protein even more to match it. And as I'm sure you're aware of, and you've talked about many times, this can make still for very enjoyable meals. Like it doesn't have to limit your satisfaction. It's just something to be aware of and to get on top of, or else you're going to lead towards more of that kind of beeline towards insulin resistant state, which is going to make it challenging to lose weight, which nobody wants. It's not just about body composition, as you're aware of, but that's kind of that added bonus of adjusting to your new physiological state, is that it's going to be easier for you to maintain your weight as well.
Yeah. And it's interesting because I feel like the whole protein discussion, helping women understand that we're in a catabolic state in middle age. So we actually require, our protein needs actually increase. And if we're not on hormone replacement therapy, so if you're a woman that is chosen not to be on HRT and you have low estrogen and high follicular stimulating hormone, your body really accelerates this catabolic process. So the other kind of piece is this loss of muscle mass with aging. So if you're not lifting weights and you're not able to hit those protein thresholds, which is why I'm never a fan of sustained OMAD. I'll just plug that in there again. My listeners definitely know that, but I just keep saying this is why we have this rhetoric, but helping women understand that our relationship with carbohydrates need to change. It doesn't mean you never eat another carb, but you're probably going to be much better off having it from low glycemic berries, root vegetables, non-starchy veggies, as opposed to pasta and bread and ice cream and cake and cookies and things that tend to be harder to limit consumption of in their totality. And so thank you for that, because I think that's invaluable. Now, it comes up often. And so obviously lifestyle comes first. So we're going to talk about, walking after meals or doing a soleus push-up, making sure your macros are put together properly, not eating huge meals in the evening. What have been some of the supplements that you have found in your research or your experience that have worked really well? Now, I'm sure that we have some common ones that we probably, have both seen are very, very effective. Chromium picolinate seems to have not gone away. That was like in the very beginning when, I was kind of pivoting from traditional allopathic medicine. Chromium picolinate seemed to be pretty popular, but I always say it's kind of like kindergarten compared to like berberine as an example. I think of as graduate school, like it can be helpful, but berberine is going to be much more efficacious if someone's really kind of struggling. Maybe they're not ready for medication, but they want to do all the things to improve their insulin sensitivity. What are the things that you generally recommend or really like?
Yeah, I would definitely agree with you that berberine is what we have seen to be the most effective and kind of across the board. So there are a lot of supplements where we see work with some people, don't work with others, but berberine seems to be pretty effective for most individuals. So that's a good place to start if you are seeing still slightly higher glucose values and you are doing a lot of the right things. So the thing with berberine too is you want to take it consistently. A lot of people will take it before a high carb meal at kind of like ad hoc situations. And there are a lot of berberine supplements that are mixed with other things that are marketed as like, a carb tolerance supplement. And we have not seen that work as well as if you're taking it consistently. So if you really want to kind of see those long-term improvements, try taking it for several weeks and see how your glucose values improve. Twice a day, typically with meals is how we see it most effective. With that being said, depending on maybe where your Achilles heel is, so to speak, you might want to take some supplements that help for stress, because that's one of the big things as you're mentioning, that we see people struggle with. It can be a lot easier for people to adjust what they're eating, to figure out the optimal exercise routine, add in the movement. And then it can be a lot more challenging sometimes to really address and dig into those stressors and the cortisol issues. So if that's one of the driving components to somebody's metabolic disturbances, then something like ashwagandha or other stress modulating supplements tend to be really helpful. The final thing that really works kind of universally is apple cider vinegar, which is not really a supplement, but you don't eat it on its own. So it's not really considered a food either, but that is helpful more of the pre-meal type of situation. So if you do know you're about to really kind of indulge in maybe more carbohydrates than you normally do, having some of that apple cider vinegar beforehand, either in supplement form or just, diluted in water and drink it as a beverage, that can be really helpful for those per meal situations.
I love that.
The other thing that we see with supplements is sometimes if you have a deficiency or you're not getting enough through your food, there are certain supplements that really help improve insulin sensitivity. But if you are getting enough through food, we don't typically see it make an additional benefit. So that's, of course, some of your classics like vitamin D and fish oil, omega-3 to omega-6 fatty acid balance, but also that's where I see the chromium be the most helpful, and also zinc and magnesium. So those are things to consider if you don't think you're getting enough through food. If you're not sure, you can kind of try it out and see how your glucose values change, but those can be helpful as well.
Yeah. And it's interesting because I know for myself, I don't take berberine with any regularity, but I would take it like, oh, I just ate gluten-free brownies, or I just had dessert after dinner. And I found that when I was monitoring my blood sugar, if I ate a steak and then broccoli and then had a dessert, my blood sugar response was pretty minimal. And I didn't notice any appreciable difference if I changed the way I eat things and then still had the dessert and even adding in berberine as needed. So I agree with you that I didn't see an appreciable difference, but there are definitely patients and clients of mine that are trying to avoid getting on oral medication for their prediabetes. And so we try to do a trial, like a 3-month trial, to see how they do. One supplement that I found that's been really helpful and not nearly as strong as berberine, that's usually better tolerated, is myo-inositol. Definitely helps with insulin sensitivity. And it's one of those things that also helps with sleep. And most of the women that I talk to are struggling with sleep too. It's kind of this, you move into like peak fertile years into like middle age, and then all of a sudden things that you take for granted all of a sudden aren't working quite as efficiently. Well, Kara, it's always a pleasure to connect with you. I do want to talk about one last topic because it's one that I find for a lot of people can be very insightful in terms of trying to manage their blood sugar better, is sleep quality. A lot of us wear wearables, we're wearing Oura rings or Whoop bands. And so we get a sense of how much REM or deep sleep we're getting. For you and your work, what have been some of the insights? Is there a minimum of sleep that you generally suggest or recommend, or where you see blood sugar or glucose better controlled? And how does that show up the following day for most of these patients and clients?
Yeah, with sleep, we really want to think about both quantity and quality. So when it comes to quantity, tends to be a little bit of personal deviation of what is best, but anywhere from 7.5 to 9 hours of sleep. So not time in bed, but of actual sleep. So depending on how long it takes you to fall asleep and, if you're waking up at all, you need to add that time into your total in bed time. I think a lot of people are like, well, I was in bed for 7 hours. It's like, well, you might've been sleeping for only 6, which is certainly inadequate quantity. And then we also want to focus on quality. As you mentioned, a good proxy for this is any of the sleep trackers out there. They're not perfect, but they're going to give you a general idea of how your sleep quality is. What I really want to let people be aware of, if you haven't already mentioned this though, is that not to get hung up on the tiny little differences on your sleep trackers from day to day, because the accuracy isn't 100%. So we see people get worried about, I had 5 minutes less of deep sleep last night, and now I feel like I'm not as on today. And it's like, that could just be noise. So look more at the overall kind of trends you're seeing in your sleep tracker. If it's consistently showing that you're getting poor sleep scores and you're getting minimal deep sleep over and over, that's an important signal. But the little deviations might just be kind of noise that it's either picking up incorrectly or, who knows what's going on there. But both of those things are really important for glucose control. And I think one of the biggest surprises that most people take away when they start using a CGM for the first time is the impact of stress and the impact of sleep, and how dramatic those can be. And there's research to back it up with the sleep as well, where a poor night of sleep, whether it's the quantity or the quality or both, can make our glucose values almost 40% higher the next day. So we can essentially induce a state of insulin resistance from one night of poor sleep. The good news with that is that it's temporary, it's fixable. So if you got a really bad night of sleep because, you're traveling or something was going on, you're sick, and then you get back into a normal sleep routine immediately after, we see those glucose values normalize. Where, of course, we really get into trouble, just like chronic stress versus acute stress, is when we're chronically sleeping poorly, because then we're seeing that basically state of insulin resistance every single day. And that's where we have to fix the root cause, which is sleep, but we also need to compensate by adjusting what we're eating and doing the next day until the sleep is fixed. Because your carbohydrate threshold, your ability to process that glucose is going to be greatly reduced if we're not sleeping well. So for some people who maybe are new parents, or, there are certain situations where maybe your sleep is not going to improve overnight, then you might need to pull on that nutrition lever a little bit differently and kind of adjust how you're eating if you know your sleep is going to be taking a hit for a more consistent period of time for a little bit.
Ironically, today I have not one, but two registered dietitians kind of back to back with podcasts. And I thought it might be fun to kind of start the conversation around archaic dietary advice or the things that maybe drive you the craziest. Now, both of us are trained in traditional allopathic medicine, so for full disclosure, but I think we have kind of gone beyond our kind of conventional training to think a little bit differently. And sometimes we take some heat for that, but more often than not, it forces people to think a little bit differently than how they originally trained. But are there particular topics or opinions that as a registered dietitian really drive you crazy?
Yes, there are a lot. We'll try to narrow it to the top most frustrating. And as we were mentioning, this is true for any field in healthcare, unfortunately. There are a lot of people who are maybe kind of just regurgitating what are the standard recommendations that big pharma or government or whoever puts out there and not really thinking for themselves or using their clinical experience in front of them. When you work with real patients, and if you're really using critical judgment, you start to see that some things don't work, even if it is traditional recommendations. So I think a lot of it is just regurgitating like the classic, like my plate for everyone, where it's like a fourth of your plate should be whole grain carbs and a fourth of your plate should be lean proteins and another fourth should be, fruit, and assuming that that works for everybody. And the standard recommendation that, 40 to 65% or whatever the crazy percentages of our calories should come from carbohydrates for the average American, assuming that that works well for most people, is something that I've just seen over and over is not true. Like when you're actually working with people and looking at the data and being open-minded and curious and really critically thinking, you see quickly that that doesn't work. So I think that one frustrates me. I also get frustrated specifically in the metabolic health space when we're working with those who have metabolic dysfunction. So pre-diabetes, diabetes, any form of insulin resistance. And we're following the traditional, like small frequent meals that always have consistent carbohydrates. With that one, we're just throwing gasoline on the fire and we're making the problem worse. So there are a lot of things that don't work in practice. I could keep going, but curious to hear some of yours as well.
Yeah, no, what's ironic is years ago when my kids were in elementary school, I was co-leader of something called Real Food for Kids. And so we were actively working to have farmers bring in like fresh fruits and vegetable and meat into the schools and educate the community. And I just recall one of the teachers that was actually the teacher of one of my children was like, could you come in and talk about talk about macros? And so I came in and he said, we just learned about my plate. And I looked at him and I said, unfortunately, I'm going to not agree with my plate. And so some of the kids were really cute. I mean, they were young, like maybe third, fourth grade, and they came up to me afterwards and they were like, what should I tell my mom? And I said,
Yeah.
okay, well, like, protein is good, healthy fats are good, the right types of carbohydrates are good. But most people, like most adults, and frankly, kids, should not be consuming, 50% of their plate should not be, crappy carbohydrates. And so, I think in many ways that's a huge one for me. I think the meal frequency piece for me is huge. And I think that on so many levels, so much of the dogma that I was trained in the 90s and early 2000s, like most, if not all of it, like even my cardiology patients, I used to make them fear fat. Like I remember the handout, I came across it a few years ago and it made me shudder, but it was bastardizing fat, eat these tasteless, non-fat, low-fat things, essentially eschewing any types of healthy, like don't use butter, don't use ghee, but oh yes, use Brummel and Brown and Smart Balance and all these seed oil spreads. Or I think the other thing that I find so frustrating is, as an example, a lot of our diabetics in cardiology, I would refer them to the diabetes educator who sometimes was a nurse, sometimes it was an RD, sometimes it was another licensed healthcare provider. And a patient came back to me and he said, I said, oh, did you register with the diabetes educator? He's like, yes, it was fantastic. And generally that's not their reaction. They meet the diabetes educator because in many instances, there's a lot of recommendations that come along with that. And he said, I've been eating bananas. And I said, okay, well, how often? He said, every day. I said, how frequently? He said, oh, I have 3 or 4 bananas every day. And I said, you're diabetic. You have a sugar handling problem. Banana is the last thing you should be eating with any frequency. And so it just reaffirmed for me that a lot of the information that well-meaning providers are sharing with patients is stuck in really antiquated dogma. And so it's not suggesting that a piece of fruit's going to get you into trouble, but if we know if you already have a blood sugar handling problem and you're not metabolically healthy, eating a lot of fruit is not a good idea. So those are
Yeah.
probably some of the ones that I find the most bothersome. And,
Yeah.
kind of siphoning off of that is thinking about like rigid dogmatism. And there's many camps. If you're on social media, and I have to believe that it's well-meaning when people say, well, carnivore worked for me, so that means it works for everyone, or veganism, or keto diets. I think that the degree of bio-individuality is so important. And I always say, like, if something works for you, that's great, but it may not work well for everyone else. And actually, the last conversation I had today, we were talking about how the research on ketogenic diets, if it doesn't work well for someone, it is likely a reflection of inflammation and the state of their gut microbiome. And so it goes back to that bio-individuality piece. I don't know if you feel similarly, like you're like, obviously ultra processed foods we want to eliminate, but being rigidly dogmatic about a particular nutritional paradigm, I think can set us up for disaster.
100%. And there are, like you said, there are some guidelines, rules, so to speak, that apply to pretty much everybody that are good general advice that we can say as blanket statements. But in general, there's a lot of nuance. And nuance isn't what gets very clickbait. We don't have a lot of attention driven to, well, this works for some people and not in this situation, with all these asterisks and nuance. But that's where health professionals really should be focusing, is working with the individual in front of them and taking that nuance into account. Because the same thing is not going to work for everybody, as you mentioned. And it might work for one person and not the other, but for the person it works for, it also might not work for them forever or at different stages of their life. So you as an individual are also going to change. So kind of removing that rigidity from the patient or client's end is also important for them to understand that they too can change. And with the diabetic, we might need to really drastically reduce carbohydrates to fix that metabolic dysfunction. And if we fix that and we've really improved a lot of things down the road, we might be able to be a little bit more flexible with those carbohydrates and kind of change some of the original things that helped fix that situation. So it does shift a lot within the person as well. And I think that's something, it's easier for us to stick to one rule or black and white thinking, because it's like, okay, this is good, this is bad, but very seldom are things truly that black and white, which is part of the reason that we use data as part of, our approach to helping people, because you see very clearly when you're looking at a little bit more objective information that we're not all the same. People do vary quite a bit, and we have to kind of adjust appropriately depending on what's happening with the person.
And I think this is so important because as someone who has prescribing privileges, I just remember, we would get asked all the time by newer practitioners, what's your favorite antihypertensive or blood pressure medicine? What's your favorite medication to treat diabetes? What's your favorite medication to treat lipids? And I always used to say, if I had 10 patients, it might be something different for every single patient, because I've come to find that teeny tiny little old ladies need a lot less medication, even if their blood pressure is insanely high. And, sometimes you don't take into account that when a patient goes into an office, that might be the worst. You'll see their blood pressure. And then at home, it's not nearly as bad. So if you hit them hard with medicines, not only are they going to struggle with compliance, but then they're not going to be happy with you and they may not come back to you. And you don't want to devolve that. Now, you're alluding to tools and data, which I'm a huge proponent of. And so I think it goes without saying, I think one of the most simple tools that we have at our disposal / problems in our society is the scale. What are your thoughts around overuse of scales, letting the scales, govern your perspective for the entire day, and the poor understanding of what the scale actually represents?
Yeah, it's a great question. It is very affordable, accessible, and everybody understands what that number means, which is why it's so widely used. And so that is valid. And like all things, like we mentioned, there's nuance to the scale, in my opinion. Some people should be weighing themselves more frequently and are just avoiding it. So with some clients, I might recommend weigh yourself weekly at the same exact time. We'll use that as a data endpoint so that we can monitor trends, but it's just one piece of the puzzle that we want to help guide us in our decision-making and making adjustments. Because if we aren't measuring it at all, it becomes that thing where slowly, you add a pound here and there, and it's really hard to notice it in the day-to-day. But by the end of the year, you're 15 pounds heavier and you don't know what happened. So when we completely don't track anything, I think that we lose accountability to some of those things that matter. But then on the flip side, there's the person that's weighing themselves 3 times a day and is doing anything at all costs in order to see that number go down without regard for the other data endpoints that are appropriate and important to consider. So for that person, I might be like, let's take a month off with no scale where we focus on a different metric that I know if they improve that metric, their weight's probably going to go down, but we're taking a break from the hyper focus and obsession with the weight. Because weight does fluctuate. It doesn't tell us the whole story. It doesn't necessarily tell us how healthy you are on the inside, even though it's a correlation to that of overall health. It doesn't tell us your body composition, muscle mass versus fat mass. So it doesn't say everything, but it is important to keep track of it, I think, overall for most people. Because there's the other camp that's like, we should never use a scale. We should never weigh ourselves. And I think that can get us into dangerous territory as well.
Yeah, that's such a good point. And to your point about looking at, fat-free mass versus muscle mass, this is when it is blaringly apparent what you're looking at. And I would highly encourage anyone that's listening, a lot of doctors' offices, healthcare providers' offices now have bioimpedance scales. Get on one of those or get a bod pod. Mm-hmm. You can't hide the data. It is blaringly apparent. I have very transparently shared with my community that I just did a bioimpedance reading about a month ago. And I've lost some muscle mass, not surprising given the stage of life I'm at, even though I do all the right things. And so my functional medicine doc looked at me and said, this is what I would like. I'd like you to gain 5 pounds of muscle. And he said, in doing so, you will probably lose 7 pounds of body fat, but I don't want you focused on the body fat because that will naturally happen as you're building muscle. And it was just very objective. There was no judging. It was just, this is what it is. And you can look at those numbers and you can impact those numbers. And so I think that is valuable. But I think I have plenty of friends that have spent their entire life being obsessive about what their weight is in the morning. And I go by how my clothing fits. That's usually my objective. Like, do my clothes feel tight or do my clothes feel comfortable? And that's kind of where I exist. But I think some degree of checking in with yourself, whether that's once a week, once a month, using a tape measure, measuring your waist and your hips. I mean, whatever works for you, I think is certainly reasonable, but we definitely are a society that is fixated on numbers. And it's interesting. I interviewed a personal trainer a few weeks ago, and she said, for some reason, the number 120 is what every woman tells me she wants to weigh, even if it's not like it's wildly unrealistic. 120 pounds appears to be the number that makes everyone happy. And I said, isn't that funny that, it could have been the weight you weighed when you were, 15 years old but I think when we're talking about weight and numbers, so much of it is not even particularly realistic. Like, I don't want to weigh what I weighed when I went off to college because I was just skinny. And so I think these bioimpedance scales and being thoughtful and meticulous about how you use these tools, I think is really important. Now, obviously, you and I are both fans of tracking glucose, continuous glucose monitors. When you're working with your patients and clients, when do you introduce this tool? Do you do it up front, or do you wait until they've done some foundational work to be able to be motivated to utilize the tool effectively?
Yeah, great question. So a lot of our customers that are working with us and coming to us are already at the stage where they're eagerly seeking out the continuous glucose monitor. So usually the reason they've come there is because they've already done some basic, learning and education on nutrition fundamentals. Like they know what macros are for the most part. They've maybe checked their finger glucose every once in a while. They might be getting labs annually. And there's some sort of trigger that's making them want to take that next level to get a deeper analysis into their metabolic health and glucose levels. So maybe a common story is they're just on the prediabetes threshold, or they just entered into that diabetes threshold, or their parents died from diabetes at the same age that they're now hitting, or they're going through menopause, or they're entering retirement, some sort of life shift that's causing them to really double down and want to make sure that they're in the best health they can be. So we also have clients that are coming to us just to start with our dietitians. And so for them, when we think they might be ready for that continuous glucose monitor is something similar. So we kind of have a good understanding of some basics. Maybe we've started to track, and then there's a good reason for us to dive deeper. Although with that being said, I do recommend that everybody wears at least one. I do not think that everybody needs to wear them for 3 months, 6 months. But most people, if they are in some sort of pre-contemplation stage of change, are very applicable and will learn a lot from wearing one for the 14-day period and learning a little bit more about their health. For those individuals, it's about that awareness step. Kind of like you mentioned with you and your weight, you go off of how you feel, how your clothes are fitting, how you're looking. But a lot of people are missing that basic kind of self-awareness and tuning in to like really how they feel and how they look and how they're performing. A lot of people aren't that, into their body signals and how they feel. So sometimes we find that data can really reinforce that and bring that connection to how they're feeling and how different things are changing a little bit stronger, which can enhance then their ability to go on without the data, but in a better, more self-aware process.
What do you think contributes to the lack of self-awareness? Like when people don't feel themselves in their bodies? Because I've started noticing that when I talk to friends or even, clients or patients, and I'll ask them about bodily awareness, I would say it's easily 60-40. 60% of people are like, I have no idea. I eat whatever. I'm not attuned to my body. It's not that I don't choose to be. I don't notice those little, how I feel, on a discretionary level versus when I do different things. So I'm just curious what your opinion is. I have some ideas, but when you brought it up, I was like, I just find that a lot of people are very disconnected from their bodies.
Yeah, I see a similar thing, that the disconnection is the norm. Maybe not the majority, but certainly a high percentage minority of people are completely disconnected to how they feel. Theories on why this might be, I think A is that it's never been prioritized as important within, traditional society or even in healthcare. Most physicians, practitioners are not asking, like, how do you feel though? How do you feel after you eat? It's more like, here's your number, here's your medication, here's your thing, very transactional. So we haven't had that ability to think about it. Sometimes when we're asking people, how do you feel when your glucose rises? Or how do you feel when you've gone this long without eating? They really have to sit and think, and then they can answer it, but they've never done that reflection. They've never even thought about thinking about it. So I think that there's just kind of a lack of importance in our society, and it's not a norm to have that reflection. And I also think when you feel a certain way for so long, it's not noticeable. Like if you have a killer migraine for the first time ever, you're going to notice it. But if you kind of have a dull, aching headache every day and sort of feel low energy levels every day, you don't notice it as much because it's almost the norm. So I don't think people reflect on those things that are more habitual in nature.
I think that's such a good point. And I think for a lot of people, they make assumptions just based on what life stage they're in. People who have young kids, they assume they're tired because they maybe don't have as much ability to have flexibility in their schedule. Maybe they're not getting the same quality of sleep they used to get. And the flip side, I think about people that are at my stage of life who just make assumptions that aches and pains and brain fog should be the norm. And that's just a normal experience, therefore shared by everyone, therefore not normal, or therefore it is considered to be normal. And yet I would argue that if you are aware of how your body feels, day to day, week to week, it can allow you to notice those subtle shifts. And it's not being self-absorbed. It is just, again, that self-observation, that checking in with yourself. I think, for so many people, I'm an introvert, so I'm always kind of taking in information and processing it. And I think because of that, for me personally, I'm just very self-aware. How do I feel in time and space? What feels right? What does not feel right? And I acknowledge maybe not everyone has given themselves the permission to be able to feel all of that.
100% agree. Yeah. I even outside of health and wellness in your physical body, I don't think being self-aware and reflective is the norm in general about all things. Yeah, so there's a lot of factors going on there, but it's certainly very common. I also think that we haven't historically weighted somebody's subjective experience about anything as important. So like our feelings have been, downplayed, where it's an important metric to take into consideration from a health perspective. Like how you feel after a meal and those subjective experiences are equally important, in my opinion, as the objective experiences.
And what are some of the common symptoms your patients and clients will report? And we'll use the example postprandially. So after a meal, that clue you in that they may have some degree of blood sugar regulation issues.
Yeah. So after a meal, some of the common subjective symptoms might be kind of that jitteriness, like think of it as like a sugar high after you're eating, followed by a crash. So that overwhelming urge to take a nap after you've eaten is a very big warning sign that something's going on with your glucose. We probably have a little bit of a roller coaster happening after you're eating. So if you feel like you truly can't focus, like you get back to your desk after lunch and it's like brain fog, like lack of concentration, irritability, like irritable, all of those are very clear symptoms that there's probably something going on. You should feel like your energy levels are relatively stable throughout the day, whether you're eating or not eating. And then for some people, if we have that crash after they eat, they can get those hypoglycemic symptoms as well. So they might feel anxiety. So a lot of people will have true feelings of anxiety after they eat. And little did they know it was because they were triggering these low glucose values after meals. It might be like shakiness, kind of jittery. You might even be sweating. Those are a little bit more extreme, but we see those even in non-diabetics, very common symptoms that your glucose is kind of plummeting after you eat.
Well, and it's interesting because one of the things that I've noticed is that when you see that hypoglycemic curve, sometimes people will then say, I know I just ate a meal, but now I'm hungry again. And it's their body's way of intrinsically trying to get some food in to raise their blood sugar. And generally, they're not craving the healthy things. They're not going for like a piece of steak and broccoli. They're very likely craving like cookies, ice cream, something that's going like a processed carbohydrate that's going to raise their blood sugar quickly, so that you kind of move away from the symptoms that they're experiencing.
Absolutely. Yeah, it's a great point. It's very common if maybe an hour after eating a real meal, if you feel hungry, then we're most likely having that roller coaster effect because it's triggering in your brain a survival response. Your brain is thinking, I don't have enough energy. You need to eat something sugary really quickly to regain normal energy levels. When really you have plenty of fuel, you're just kind of having a difficult time processing it. And back to your first question about pet peeves and the common, dietetics industry, that's another one of like small frequent meals where we're doing like the 100-calorie packs of like, I don't know if you remember all the 100-calorie packs of like mini Oreos or mini pretzels or whatever it was, where we're trying to control our calorie intake by eating these 100 calories every hour or two. But what's really happening with those is your glucose is going up and down all day, and you're probably eating more, which is actually going to lead to weight gain because you're not ever feeling satiated or really giving your body the fuel that it needs.
Yeah, I think it's such a good point that, just that building awareness around putting your macros together, what's going on with your blood sugar. Now, I know that blood sugar spikes are a hot topic because, in some ways we want to avoid overt and prolonged blood glucose excursions. Having said that, I know that, if you eat a meal, depending on what you've consumed, you're going to see changes in your blood glucose. Obviously, you know, fat is going to have a more negligible impact than carbohydrates, but we do expect your blood glucose to go up in response to a meal. For you personally, what number do you like to see? Like, let's say you start at 90 milligrams per deciliter before you eat, and then you go up to 150. That's a 60-point increase. I know that you probably would like a tighter control, but what is your prevailing kind of thought process around blood sugar spikes? Like, when should patients be concerned? When do we need to not stress about it? Because the other thing that I've started seeing is people proudly showing online, like their blood glucose has literally gone up by like 10 milligrams per deciliter all day long. I'm like, well, I don't think that's the intention. That's not what we're advocating for, because I think that's entirely unrealistic for most people. But where is your comfort level when you're working with clients talking about those glucose spikes in a way that this is pathologic and this is non-pathologic?
Yeah, great question. The number one glucose myth that I'm always trying to reiterate is that your glucose has to be a flat line, as you mentioned. That is not the goal. And it doesn't mean if there's some variability or some increases and decreases that you're unhealthy or that something is wrong. And I think that sets people up for failure, and it starts to then become an emotional number like the scale is. And that is not what we are trying to create. I have so many influencers or people I'm talking to that are like, well, my glucose rose 10 points, so I did something so it only rose 5 points. And it's like, that's actually not the goal. And if we're trying to teach that to people, then they're going to get really upset if they have some metabolic dysfunction and their glucose rises 80 points and they're really, really far away from that. So with that aside, what I do look for is how high, like the absolute value, the max value it went. And then what is that difference? Like you said, that jump from baseline up. And then how quickly do we kind of return back to normal levels? So generally for a non-diabetic, we are aiming for that max glucose value to be under 140. That's a good rule of thumb. However, if somebody hits 150, 160, I'm viewing that as an undesirable, but likely metabolically normal response. If you first thing in the morning chug some juice and your glucose goes to 155, I'm not going to be worried necessarily that you have severe insulin resistance. We're going to say that probably wasn't the best choice. That was a high glucose spike. You most likely didn't feel good. Let's think about how we can adjust that response and change what you're eating. However, if you have that juice in the morning, your glucose goes to 220, 230, your body's likely having a really hard time processing that appropriately. And we probably have some insulin resistance, metabolic dysfunction that we need to heal in order to have better responses. So we want to aim for under 140 for the best optimal health outcomes, but 150, 160 doesn't necessarily mean you have a problem. For that jump, for the optimal health outcomes, we want to see kind of a jump less than 40 for that more stable glucose levels, kind of 30 for some research articles are mentioning, but again, it's newer information, especially in the non-diabetic space. So I see a lot of people cherry pick where there was one research article that was maybe questionable methodology that said, oh, it was normal for people to have a 20-point increase. So then they're like, nobody should ever jump more than 20 points. I think that's an unfair extrapolation of the data. So 30 to 40 point increase is probably normal, especially if you're not doing it every hour or two. If you're doing it 2 to 3 times a day when you're eating, perfectly normal. If your glucose jumps 80 points, but you stay at that 140 threshold, that's a pretty big increase. And that means that you're jumping quite a bit, that big area under the curve. And then lastly, we do want to see your glucose levels kind of return back to normal about 2 to 3 hours after eating. So for sometimes when we see early signs of metabolic dysfunction, it might go to 140, but then it takes 7-8 hours to get back down to that normal range, which is going to bring your average glucose levels up because you're never really kind of getting back down to those normal levels. So that would be another kind of clear indicator that maybe we have some work to do, some healing work to do.
Yeah, so big takeaway for anyone who's listening. If it's a one-time event, do not stress about it. But if you're noticing you've got a prolonged period of time where your blood glucose remains elevated after a meal beyond that 2 to 3 hour window, it might have been the meal you ate, but if it's happening with some frequency, it may be that you are heading in the wrong direction in terms of metabolic health. Now, I'm sure you probably, with all the data that NutriSense has, you probably see a lot of trends around women's menstrual cycles. Obviously, we know we're more insulin sensitive in the follicular phase. We're less insulin sensitive in the luteal phase when progesterone predominates. Do you find that to be the case with your clients when you're working with them as well?
Yeah, absolutely. We do see these differences during the menstrual cycle. In some women, it seems more pronounced than others, which goes to show the bio-individuality. Some women, you really can't notice much of a difference. And some, it's pretty dramatic, pretty noticeable. I happen to be in the more dramatic group, so I can, experience this firsthand, where during that luteal phase, when we kind of have lower estrogen levels, we tend to see those higher glucose values, and you're in a more insulin resistant state. So during that time, you might just want to be more aware of your carbohydrate intake, especially kind of what you're eating, when you're eating. It also, unfortunately, tends to be the time when we have more cravings for things like that. So I do find that awareness is that first step, kind of helping women become aware that this could be a factor, actually really helps to reduce the cravings. Just the acknowledgement that, okay, this is a normal physiological change. This might be why I'm feeling this way. It empowers you to make different decisions if you're aware of this, rather than just being like, I'm craving something, so I'm going to do whatever I want, and not kind of understanding why it's happening or the implications of that. But yes, we do see a little bit of that shift in kind of insulin sensitivity at those different phases of the menstrual cycle.
Yeah, and I would imagine that women in perimenopause and menopause, it's probably even more exaggerated, especially because what you get away with in your 20s and 30s, you can't per se get away with in your 40s and 50s and beyond. And so one of the things that I see is as women are losing muscle, so this degree of sarcopenic obesity becomes an issue. As they're losing muscle mass, they're also further losing insulin sensitivity. And this is why I love using CGMs so much, because it will objectively give them information that allows them to make better decisions. Because that's ultimately why I think these tools are so valuable, is allowing people to objectively see the information, discuss it with their healthcare practitioner, and be able to say, okay, well, I actually can't eat plantains. I think I talk very openly about this on the podcast. I can eat a lot of starchy carbs, but plantains, it doesn't matter how I eat them, what I eat them with, they spike my blood glucose so significantly that I'm like, this is so sad. I love plantains, but they don't love me.
Yeah, 100%. And this is this is an area where we see pretty consistently all women in perimenopause, menopause see that change in their glucose values. Unfortunately, it's a true physiological change that is happening, where it's kind of that more dramatic and prolonged effect that we see during the menstrual cycle. So of course, we're having real hormonal changes, and this changes our physiology and the way that we're able to process some of these more carbohydrate foods and our glucose disposal, or our ability to remove glucose from the bloodstream. So we do kind of see this across the board, where women tend to be less insulin sensitive. So their total carbohydrate threshold, or how much they can eat and still maintain good glucose values, decreases. But as you mentioned, we see variability between women, and the biggest factor that determines that variability is their level of muscle mass, which does, as you mentioned, decrease throughout this stage. But the women who are actively working on maintaining or adding muscle mass, they fare much better throughout this. So that's the number one thing. And I know you feel similarly, that we recommend over and over, is to really prioritize strength training, building that lean body mass, and prioritizing enough protein to fuel that muscle mass production, because we also have increased turnover of our proteins during this time, which means we need even more protein than we might have needed at different stages of life. So it is a big change in our glucose levels, but there are things you can do to make it a lot better. And as you mentioned, there's also the things that are going to be unique to you, like plantains. Somebody else might not have that response to plantains, and it might be something else that they find is just the food thing that doesn't work for them. That's the food source that no matter how they adjust it, how they kind of mitigate the response, they just always have big glucose responses to it. And so part of the data is empowering you to know what works best for you. And I also find that then it's a lot easier to stick to those recommendations or habits once you've seen it with your own eyes of kind of your data and your body's responses. Whereas, if your healthcare professional tells you you really need to exercise more and cut out all carbohydrates or reduce your carbohydrates by half, it's like, oh, I feel like I'm being forced to do something I don't want to do. It's kind of like, nah, I don't know if I want to do that, which makes it hard to stick to. But when you see, okay, I can have this many carbohydrates under this circumstance, but not this one in particular. But when I strength train, it's much better. When you find out those variables that really work for your body, then I see that women particularly are much more empowered to kind of stick to that. And then that's what helps them get the long-term results that we really are looking for.
Yeah. And it's so interesting because it's human nature. We oftentimes want to fight against what we perceive is not sustainable. And so that's why I think having devices allows us to kind of objectively look at the information like, yes, I love plantains, but I don't love them enough to watch my blood glucose spikes go. And it was substantial. It was like 60 points. I mean, not something that I ultimately want to recreate for myself over and over again. But there are plenty of other alternatives that are out there that don't impact my blood glucose quite so significantly. What are your thoughts around training? So, especially things like really intense exercise, like sprints or high intensity interval training, or not so much endurance work. I guess because so many people that listen to this podcast are largely women north of 35, so perimenopause and menopause. So there's a lot less long-term endurance work going on. But when women are seeing significant increases in blood glucose related to specific physical activities, even like hiking, I'm thinking about you being in a very warm desert-like conditions. And I'm sure if you're doing a lot of hiking at an intense level, that could also free up some additional glucose.
Yeah. And what's important to realize is that during exercise, our glucose might have a specific response, and that is different than the potential overall impact exercise is having on our glucose levels. So during exercise, depending on the intensity level, our glucose can be stable, it can decrease, or it could actually increase. And a lot of people get kind of confused on this point. So I always like to emphasize it. If you're having intense exercise, so like you said, kind of hiking, especially in hot weather, doing HIIT training, sprints, maybe heavy weightlifting, you might actually see your glucose levels spike during that exercise. But that's a supply and demand thing. So your body is saying, I need a lot of energy. This is intense exercise. And then your body is supplying it to fuel that exercise. So that's a lot different than if we're just sitting on the couch and we drink that juice and our glucose spikes and our body doesn't actually need that energy. So if you see a spike while you're exercising, don't worry about it. That's completely physiologically normal. But exercise is one of the most powerful tools we have in the long run to improve our metabolic health, improve our ability to decrease and dispose of those glucose responses, and improve our insulin sensitivity overall. So the exercise I really recommend the most for that, strength training, again, the more we can build up our muscle mass, the more storage area we have for glucose to go, because it can go in our muscles and it can also go in our liver. And our liver only has so much space. So the more muscle we have, the more ability we have to dispose of that glucose. And then when we're using our muscles, when we're exercising, we're also freeing up some of that glucose. So we're using it to fuel our energy, and we're making sure we're having good turnover of that storage space so they don't get too full and then there's nowhere for that glucose to go. So strength training is a big one. And then I think HIIT exercise, or kind of some of that more intense exercise, can be a really good, helpful tool as well for utilizing some of that energy, improving insulin sensitivity. And then walking, just kind of like steady state movement, lots of movement throughout the day, is a really, really powerful tool for glucose management. So that's often if exercising is intimidating, or you're not used to working out and maybe you're working your way up to that, just making sure you're getting enough movement throughout the day is a really good place to start, because it makes a really big difference in our metabolic health and glucose levels.
Yeah, it's so interesting because that non-exercise induced thermogenesis. I'm like, if you do nothing else, just keep track of like how many steps you're taking during the day. Like this past week, we were with my son at his parents' weekend at college, and he was telling me that he did a lot of walking on campus. And I was like, well, of course, you're a college student. Well, by the end of the day, we had walked 7 miles, kind of traversing back and forth across the campus. And I looked at my husband, I said, he's walking quite a bit. He was actually completely correct. But by the end of the day, we were like, wow, that was a lot of walking, but not in a bad way. It was more of just like that bodily awareness. But on days when I'm not walking around a college campus, I try, between dog walking and just running errands and doing things like trying to make sure every hour I'm getting up. It really does, as you said, make a huge difference. And walking after meals in particular, I used to make fun of the families that did that. And now I've become one of those people that would walk, oftentimes the adults would walk in the evening. I'm like, it's a great way to dispose of glucose for sure. What are your thoughts surrounding things like hormetic stressors, like cryotherapy, cold plunges, infrared sauna, et cetera, in terms of impact on blood glucose excursion?
Yeah. And again, with these, nuance is also important, and kind of looking at each person individually, especially when we're talking to a health conscious female crowd. Sometimes we can do too many things. That is a very real thing. So each thing individually in isolation are usually helpful tools. So cold therapy and heat therapy are both proven to improve glucose levels and insulin sensitivity overall. So they can be really good tools for multiple different health benefits. Similarly, kind of some of the other hormetic stressors, like maybe extended fasting, or kind of some other things that put your body in that stress state, they can be really good things in isolation. Where we start to sometimes see issues, and I rarely, if ever, see this issue in men, so I'm really talking to females primarily here, is when we have stacked too many things and our cup is overflowing, essentially. So if you think about your ability to tolerate these stressors as a cup that has a limit, we can overflow it. And when that happens, you're actually adding true physiological chronic stress on your body, which then we actually see your glucose levels increase over time. So especially if you're already kind of lean, if you're already a normal weight, relatively low body fat, the more we add these on top of each other, the more we might see it become too much. So a very classic example I see are the very well-intended health conscious women who are a normal body fat percentage. They're doing a HIIT workout class every single day, and then they're doing the cold plunge and sauna, and then they're only eating one meal a day, maybe two. And their glucose levels are kind of all over the place. They're in a very stressed state. And they also tend to be women who have more just kind of like stress levels in general. They tend to kind of be type A, hyperfixate, perfectionist, that maybe just kind of have a little bit of chronic stress as a baseline. And so when they eat their one meal a day, we see their glucose levels stay elevated for 12 hours sometimes. We can see their glucose levels spike from just kind of daily stressors, even when they're fasting. So again, there is a little bit of nuance here where too much of a good thing can be a bad thing, but overall, each thing individually can be helpful.
Well, and it's so interesting to me. I was interviewed on another podcast a few months ago, and the first question that was asked was, what are your thoughts on hormetic stressors? And I said, it's like many things. Before you start adding, additional hormetic stressors, like what are your macros like? Are you sleeping through the night? Are you physically active every day? Like thinking about the micros instead of thinking about the macros, the ones that have, the largest net impact on our health and wellness outcomes. And so when I was asked this question ahead of us talking, I thought to myself, this is in many ways what, it's like the big squeaky wheel. It's the thing that gets attention because we see all these influencers getting in cold plunges. And by no means am I being critical. I'm just saying, like, sometimes people decide they want to do that instead of cleaning up their nutrition and focusing on sleep. And so you're right that it's hormesis is so much about the right amount at the right time, whether it's time in your cycle, time in your life. I mean, I get plenty of hormetic stress from a cold shower. I don't even need to do a cold plunge. And I think there's even some genetic susceptibility to this. I always prefer being warm over being cold. Do I do the cold therapy? Of course, but I would never get in a cold plunge because I think I'd probably have a small heart attack. Not literally, but it would be way more stress than what my body needed. But I think for people that are listening, I feel like well-meaning, well-intentioned influencers, wellness professionals talk about these extremes that they do. And really, that's like the icing on the cake, meaning if you're already doing all the other things, then add one of those in, but don't feel like at the expense of eating a more nutrient dense whole foods diet and moving your body and sleeping, what the message is we want you doing infrared sauna and cryotherapy over the macros, which are the most important.
100%. It's a really good point where we can't skip over the basics and do the supplemental items. Similarly with supplements, they're called supplements because they're supposed to be supplemental. I'm sure it's a question you get a lot of, what is your favorite supplement, or what do you recommend, or what supplement can I take to improve my health? And while I do think they have a time and a place, they are supplemental to doing the basics first. You can't replace a bad diet with any sort of supplement or cold plunge or sauna therapy or whatever it is. Those basics, like you can't skip exercise and just do a cold plunge instead. And I understand why people want to gravitate towards it because they're easier things, right? It's 5 minutes of this, or it's one pill to take. It's less overwhelming than thinking about fixing your sleep or fixing your stress levels. But we will get much further by focusing on those basics first, kind of that 80-20 rule. Those, our exercise, our diet, our sleep, and our stress are going to be the things that we have to focus on first before we start kind of fine tuning and optimizing all the other little levers.
No, such a good point. And I think for, people that are listening, really understanding that we want to focus on the big things first before we worry about the minutia. Last in terms of topics that I think is really important when we're looking at macros. So obviously we're both proponents of protein. I know a lot of women are confused about whether or not they should eat more carbohydrate or they should eat more fat. Many women are told don't eat fat and carbs together because it'll make you gain fat. What are your prevailing thoughts and how do you help women kind of navigate these choices?
Yeah, great question. As you mentioned, first, I want to focus on protein. So instead of what do we limit, what do we remove, what do we not do, we want to focus on the things that we do want to do and get there. And I naturally see usually if we focus on protein and we're super prioritizing that, we're tracking our protein, we're making sure we're getting enough, we naturally tend to fix the other areas a little bit better because there's not as much room for other things if you're actually getting your protein needs and you're making your meals big enough so you feel satiated, you're tuning into how you feel, you're kind of stopping when you're comfortably full, not stuffed. So if we're paying attention to some of those body signals, like we mentioned, and really focusing on protein, the other stuff tends to improve a little bit naturally. So we'll start there. And then if we've got protein down, we're doing a really good job. We'll decide on carbohydrates based on your glucose levels. So we really kind of want to adjust that carbohydrate threshold based off of what the numbers are telling us. And that's usually, we can start at a different starting place depending on where you're kind of at in life. If you are an overweight female going through menopause, I'm going to probably start your carbohydrates on the lower end, and we'll adjust. Maybe we actually can add a little bit more. Maybe it's just a different balance of different types at different times of day. Whereas if you're my 25-year-old bodybuilder male, you probably can consume a decent amount of carbohydrates, and you might actually need those if you're working out multiple times a day. So you're going to have a much higher threshold. So that threshold does kind of depend, and then we fill in fat with the rest and really prioritize from a baseline whole foods. So even if you're not sure how much fat to have or how much carbohydrates to have, we want to focus on food that's in the most original state as possible. So usually that means that there is going to be some natural fat present, and that's not something that we need to be scared of or that we need to excessively limit. And we definitely don't need to avoid carbohydrates and fat together. These three macronutrients exist in nature. It's okay to eat all three of them at a mealtime. Nothing's going to happen. What tends to be a problem is with the hyper-processed, hyper-palatable foods tend to be a combination of very refined carbohydrates and very refined fat, which make it delicious and addictive and very caloric and very easy to overeat and wreak kind of havoc in our bodies from a cellular level and just from an overall ability to maintain our cravings and our satiety. So if we're focusing on whole foods that are in the most, whole unprocessed state as possible, then we don't need to worry about fat and carbohydrates together. Just really thinking about satiety and prioritizing that protein as the first two rules to think about.
And thank you for that, because I feel like I field that question almost daily. And I think it really comes from well-meaning people. You'll hear this prevailing theme. I know these people are well-intentioned, well-meaning, but then it makes nutrition even more complicated. Mm-hmm. And to your point about the athletic teenagers, I have a very, very, well, both my boys are very athletic, but one in particular is very interested in building muscle. And so he tracks his protein and carbohydrates. That's all he worries about. And the amount of carbohydrates this kid eats is unbelievable. And he's super lean and he's, very healthy, but it cracks me up. I mean, it's like, 2 cups of rice with a big load of protein, my kids make these rice bowls, and I'm like, if I ate that, I would feel entirely differently than you did, but you go and you enjoy that because you have so much more muscle mass on your body to distribute all of that glucose disposal. Please let listeners know how to connect with you on social media, how to learn more about NutriSense and your continuous glucose monitors.
Yeah. So to find NutriSense, you can just go to our website, nutrisense.io. So we offer the continuous glucose monitor programs, as you mentioned, but we also offer the ability to talk to dietitians that have been trained by me and are kind of that 10% or 5% or whatever percent they are that are really going to look at the person and take a more functional approach. So we offer free consults if you just kind of want to start there. We also have a blog and a newsletter if you want to learn and kind of see what we're thinking about in the metabolic health space. On social media, you can follow me, Kara Collier RD, and then NutriSense account is NutriSense.io, both of which we're putting out tons of information on glucose, metabolic health, nutrition, all of the things.
Well, thank you so much for all you do. It's always a pleasure connecting.
Yeah, always fun to chat.
Hey, if you like this video, you guys are going to love this video, and I'll see you there.
If you have either uncontrolled diabetes, and this goes for type 1, type 2, LADA, MODY, any form of diabetes, if you follow the standard, if you follow no advice, you're probably going to hasten your death even more than 3.5 years for each decade you have it. But if you follow the standard advice, the state-of-the-art advice, the scientific consensus advice, then yeah, you're probably going to be knocking 3.5 years off your life for every decade that you follow the American Diabetes Association recommendations.